morning everyone. We will start the program now. I request all the dignitaries to occupy the dais. Good morning everyone. Good morning distinguished dignitaries, honored guests, my dear teachers, our beloved Principal Dr. R. Suchitra in her absence, and all my dear friends. A very warm welcome to each one of you. Today we have gathered here for a meaningful purpose to spread awareness, to inspire hope, and strengthen our collective fight against cancer through the initiative of Bhavani Memorial Endowment Program.
Cancer is not a disease sentence, but rather it is a life sentence. It pushes one to live. This program is being organized under the departments of undergraduate biotechnology and microbiology, along with a postgraduate program in biotechnology, reflecting a shared academic commitment to social responsibility and public health awareness. Your presence here reflects compassion and a collective resolve toward building a more cancer-aware society. Thank you for weighing this noble effort.
Before we commence today's program, and in keeping with our tradition, let us begin by invoking the blessings of the Almighty. And I'll invite the students of the second year BSc Biotechnology to present the invocation song. Thank you.
शरणु विद्या प्रदायका
Thank you for that soulful and serene rendition. Continuing with our tradition, I now request our respected dignitaries and the head of the departments, both UG and PG, to kindly come forward for the lighting of the lamp.
शुभं कुरुध्वं कल्याणम् आरोग्यं धनसम्पदः शत्रुबुद्धिविनाशाय दीपज्योतिर्नमोऽस्तु ते दीपज्योतिर्नमोऽस्तु ते दीपज्योतिर्परब्रह्म दीपज्योतिर्जनार्दनः दीपज्योतिर्परब्रह्म दीपज्योतिर्जनार्दनः दीपो हरतु मे पापम् सन्ध्यादीपनमोऽस्तु ते ओ दीपब्रह्मरूपस्त्वं ज्योतिषां प्रभुरव्ययः ओ दीपब्रह्मरूपस्त्वं ज्योतिषां प्रभुरव्ययः आरोग्यं देहि पुत्रांश्च मतिं स्वच्छाङ्गि मे सदा रवेरस्तं समाय.
Thank you, esteemed dignitaries and HODs.
Once again, you thank them.
Thank you, esteemed dignitaries and the HODs, for inaugurating today's program.
To truly understand the vision and purpose behind today's initiative, it's important to learn about the foundation that has brought us all together. I now invite Dr. Bri R. Mrunalini, Head of Department PG Program in Biotechnology, to introduce the Bhavani Memorial Endowment Program and share his journey and mission.
A very good morning to the dignitaries on the dais and off the dais, my dear colleagues and dear students. I'm standing here, fortunately, as the faculty of NMKRV College. But for today's purpose, I am here also as Bhavani's very close friend. So before we know about the endowment program, we should know about Bhavani. Bhavani and myself and many other classmates, we were just like students like all of you of NMKRV, first batch of BSc Biotechnology students. And very proudly I say Suman ma'am was our teacher. So we started our journey here. And just like how you are all enjoying the college, enjoying the teaching, enjoying fest and many other things, we also grew together, and our bond with each other grew really very strong. So Bhavani was my buddy, what you can call as a close friend. And things went well. We graduated, and she went on to do her master's in Bangalore University. And I was working with CIPLA for a year. I took a break, and then I went on to do my master's and PhD in Bangalore University. After her master's, she got married to Mr. Nagaraj. So, avaga yenagate ಸ್ವಲ್ಪ ಬ್ಯುಸಿ ಆಗ್ಬಿಡ್ತೀವಿ ನಾವು ನಮ್ಮ ಲೈಫಲ್ಲೇ. ಮದುವೆ, ಕೆರಿಯರು, ದೆನ್ ಮಕ್ಕಳು. So as women, it becomes a little difficult to catch up with each other. So that was exactly what happened to us. But then we were in touch. And then ಮತ್ತೆ ಎಲ್ಲರೂ ಸೇರ್ತಾ ಇದ್ವಿ. ಒಂದ್ಸತಿ ಸೇರಿದಾಗ ಭವಾನಿ ಮಗ ಚಿಕ್ಕೋನಿದ್ದ, a few months old. Bhavani's father is also here. ಸೊ ಅವಳ ಮನೆಯಲ್ಲೇ ಪಾನಿಪುರಿ ಪಾರ್ಟಿಗೆ ಸೇರಿದ್ವಿ ನಾವು ಫ್ರೆಂಡ್ಸ್ ಎಲ್ಲ. ಸೊ ಅವಾಗ ಹೇಳ್ತಾ ಇದ್ಲು, ನಾನು ಭವಾನಿ ವಿ ಹ್ಯಾಡ್ ಅ ವೆರಿ ಸ್ವೀಟ್ ಟೂತ್, ತುಂಬ ಸ್ವೀಟ್ಸ್ ತಿಂತಾ ಇದ್ವಿ. ಅವಾಗ ಹೇಳ್ತಿದ್ಲು, ಯಾಕೋ ತುಂಬ ಹೊಟ್ಟೆ ನೋವುತ್ತೆ ಕಣೆ ನನಗೆ, ಗ್ಯಾಸ್ಟ್ರೈಟಿಸ್ ತುಂಬ ಜಾಸ್ತಿ ಆಗಿಬಿಟ್ಟಿದೆ ಅಂತ ಹೇಳಿ. ಅದಕ್ಕೆ ಹೇಳಿದೆ, ಆಸ್ ಫೀಮೇಲ್ಸ್ ವೆನ್ ವಿ ಆರ್ ಜಗ್ಲಿಂಗ್ ಬಿಟ್ವೀನ್ ಕೆರಿಯರ್ ಆ್ಯಂಡ್ ಫ್ಯಾಮಿಲಿ ಆ್ಯಂಡ್ ಬೀಯಿಂಗ್ ಮದರ್, ವಿ ಡು ನಾಟ್ ಪೇ ಮಚ್ ಅಟೆನ್ಷನ್ ಟು ಅವರ್ ಓನ್ ಹೆಲ್ತ್. ಸೊ ಅವಾಗ ಹೇಳಿದೆ, ಫಸ್ಟ್ ನೀನು ಹೋಗಿ ಡಾಕ್ಟರ್ನ ಕನ್ಸಲ್ಟ್ ಮಾಡಬೇಕು, ಮತ್ತೆ ಬೇರೆದೇ ಎಲ್ಲ ಅಂತ. ಸೊ ಜನರಲಿ ವಾಟ್ ಹ್ಯಾಪನ್ಸ್ ಇಸ್ ವೆನ್ ವಿ ಆರ್ ಬಡೀಸ್, ಪ್ರಾಬ್ಲಿ ಅಪ್ಪ ಅಮ್ಮನ ಹತ್ರ ಹೇಳ್ಕೊಳಕ್ಕಾಗ್ದಿಲ್ದಿರೋದನ್ನು ನಾವು ಫ್ರೆಂಡ್ಸ್ ಹತ್ರ ಶೇರ್ ಮಾಡ್ಕೋತೀವಿ, isn't it? Yeah, so that's how it was. And it all went well. She even went to University of Glasgow and pursued her masters in bioinformatics. And then yes, she came back, after which she had 2 kids and she was also working. But suddenly things changed. So ಎಲ್ಲರೂ ನಮ್ಮ ಜೀವನ ನಡೀತಾ ಇತ್ತು, ಹೀಗೆ ಎಲ್ಲರದು ನಡೆದಂಗೆ ನಮ್ಮ ಜೀವನನೂ ನಡೀತಿತ್ತು. But things changed when she was diagnosed with cancer. And unfortunately, when she was diagnosed, it was in the 4th stage, when nothing much could be done. But then idagiddu on the day of her 15th wedding anniversary. So it was a very devastating news, I can say, for all of us. There was nothing much, of course, for the parents as well. Nothing much that could be done, and we lost Bhavani. This happened in 2014. I still remember. I'm sorry if I'm getting emotional. That day I had to go to Coimbatore to present my paper as part of my PhD, along with my research guide. So research guide jothe hodaga ಒಂದು ಸ್ವಲ್ಪ ಭಯ ಅದೆಲ್ಲ ಇರುತ್ತೆ. But I totally lost I can say that was my worst presentation, and he was surprised. He told, ಏನಾಯ್ತು, why you couldn't present anta. So that was the day I lost my friend. So we friends thought, idi thara agbardu. What is it that we can do for Bhavani? She's no more, but what is it that we can do in the loving memory of our friend? So that is when some of we close friends, Basanti anta, I would want to mention Basanti here. She's in the University of Massachusetts now. And also another buddy, Sneha anta, she's a Pilates instructor now. And many other friends. We thought we will pull in some money, whatever is possible from each of our end. And then we approached Suman ma'am and the then principal, Dr. Snehalata. If we can pool in money and then we can contribute that towards cancer awareness among young crowd and many others, where it has to be a social outreach, where people should be able to get the benefits of an early screening, early diagnosis, treatment, and they should be back to their lives. So this was, we started with we were not sure where we will really get to, but then when we started, yes, we had a lot of pulling. And I should mention Bhavani's father, Dr. Y T, also welcomed, and he contributed quite a lot and supported us. So I take this opportunity, and I'm very grateful to RSST Trust, the then principal, and our beloved Suman ma'am and Y T sir for having supported us a lot in making this really happen. So this fund was instituted in 2018, and we have a corpus, and from the interest that is earned, we conduct this program. And I should say Kidwai has been very, very supportive to us in running the program. So here we are. I request all of you to take this opportunity to learn more, spread the message, know what cancer is and what can be done to prevent it and what are the treatments. And thereby, we hope we will not have any more Bhavanis. Thank you.
Thank you, ma'am, for those heartfelt and deeply meaningful words. Your reflections not only introduced us to the vision behind the Bhavani Memorial Endowment Program, but also reminded us that behind every initiative lies a story shaped by friendship, memory, and enduring human connection. Thank you, ma'am. I now request Professor Suman Prasad ma'am to welcome our guests to the stage by presenting them the saplings.
Can I take it, Yes. Good morning. It's my pleasure to welcome you all to this social initiative by the UG and the PG departments of Biotechnology and NMKRV College. The department has been conducting this event in association with Kidwai from almost 2019. And the main objective of this event is to create awareness among all the students and the general public on cancer. This year, to inaugurate this program, we have with us Dr. Bhavani Y T, Director of Kidwai Memorial Institute of Oncology. Sir, a very warm welcome to you on behalf of RSS Trust and NMKRV College. We also have with us Dr. Ashwath Rao. Sir is the General Surgeon of Saukhya Bharati Healthcare. He is basically an MBBS doctor but is now involved in Ayurveda. Sir, a very warm welcome to you. This event would not have been, this whole endowment program would not have been possible without the support and encouragement given to us by Bhavani's father, Dr. Y Tulajappa. He is the ex-vice principal and the head of Department of Botany, National College, Bangalore. Sir, it's always our pleasure to have you with us. I would also like to welcome Dr. Debajyoti Sarkar. Sir is the general physician from Delhi and a very courageous cancer survivor who will be talking to you all maybe towards the end of this program. A very warm welcome to you, sir. I also welcome the entire team from Kidwai who will be helping us in conducting the cancer screening camp today, led by Dr. Mahantesh from Kidwai. So once again, a warm welcome to the entire Kidwai team who will be helping us in conducting the cancer screening camp. The team is led by Dr. Mahantesh from Kidwai Institute. The screening, sir. And I would also like to welcome the team from Saukhya Bharati Healthcare who are here with us to help us in creating this awareness. A very warm welcome to you all. And finally, a very, very warm welcome to all the bright young faces sitting here, to all the young faculty members, to all the students who have assembled here. Thank you and hope we have a successful day. Thank you.
Thank you, ma'am, for graciously welcoming our esteemed guest and setting the tone for today's proceedings.
I now request Ms. Sanjana V to introduce Dr. Bhavani Y T, Director of Kidwai Memorial Institute of Oncology.
Good morning, everyone. It is truly an honor and privilege to introduce a visionary leader in oncology, Dr. Bhavani T, Director, Professor and Head of the Department of Radiation Oncology at Kidwai Memorial Institute of Oncology. Dr. Naveen has been associated with Kidwai since 1996 and has served as faculty for more than 2 decades. He completed his MBBS from Devraj Urs Medical College and went on to pursue his MD in Radiation Oncology from Kidwai Memorial Institute of Oncology. Additionally, undergoing advanced international training in high precision radiotherapy, brachytherapy, and robotic radiosurgery in the USA, Greece, and Poland. Dr. Naveen has been instrumental in transforming radiation oncology services in Karnataka by establishing cutting-edge techniques including image fusion systems and permanent implant brachytherapy. Under his leadership, these highly sophisticated treatments are provided to patients, many of them from economically weaker sections and some even free of cost through government schemes. He is a committed postgraduate teacher, guide, and researcher who has authored and co-authored more than 48 national and international publications in widely reputed journals. Beyond hospital walls, he is deeply committed to public health advocacy. Through statewide cancer awareness programs, media appearances, police department awareness camps, corporate health talks, and women's health initiatives, he has consistently worked towards early detection and prevention of cancer, for which he has been bestowed with the prestigious Kempegowda Award and received national appreciation for performing one of the country's first prostate permanent implant brachytherapy procedure. Sir, your journey is a testament of academic as well as clinical excellence and an unwavering commitment to equitable cancer care. It is with immense respect and admiration that we welcome you today. Thank you.
Good morning, Shubhodaya, Shubha Munjane. It was such a nice introduction. Thank you. Before I really talk, I am supposed to give a keynote address. I've just come open-minded because I just don't want it to be boring address where you all say I just keep on putting on slides and you keep seeing that and the message what is to be conveyed is not conveyed. So I want this to be an interactive session, and this is my second year as coming here as a chief guest, and I am very, very, very proud also one way, because NMKRV and RVPU institutions have been doing this event almost every year without fail. And fortunately, I have been associated from the past 2 years as a director itself. So, at the outset, from Kidwai, we are very pleased to be associated with NMKRV as well as the RVPU institutions for the noble cause what they have put in today. Especially the Mrs. Bhavani, who has been, I think she was a teacher also here. She was a student, and it's a very nice thought of making this a positive impact and making some difference, really. And thanks to if I'm not wrong, Brunalini madam, for this beautiful idea. Now, to come to the main topic, what I'm supposed to talk. Before I start my talk, I would like you to understand what's the burden of cancer and why this awareness is very important for the society as a whole. I'll just briefly tell what's the cancer burden in Kidwai itself. In fact, I would like to tell both the global data as well as the Indian data. The Indian data is almost 74 to 75 lakhs people or at any given point of time are suffering from cancer. When it comes to Karnataka, around 5 to 6 lakhs people there is a prevalence of cancer in Karnataka. When it comes to Kidwai as such, 2024, and this is the 2025 data, 2025 data, we had around 4,08,000 cancer patients who came for follow-up. 4,08,000 cancer patients who came for follow-up, and there were 26,000 new registrations. Out of this 26,000 new registrations, 22,000 patients were proved to have cancer. Means this is in general the burden of cancer. And nowadays it has become so routine that cancer has become like any other disease, like any other non-communicable disease like hypertension or diabetes. So when this is the burden of cancer, when this is what we are undergoing, when the nation is undergoing, when Karnataka is undergoing, or the burden of cancer is so much, it's the first aspect would be the prevention of cancer. What can be done and where it is to be done and how it is to be done. As you all know, prevention is always better than cure. This being, and we have all studied also, be it disease or be it any mistakes we do, it's better we don't do that mistakes, or better we prevent doing those mistakes. So the first thing what we need to do is prevent these cancers. Can we really prevent these cancers? Yes, we can. I'll tell you why. These cancers, what I told, the cancer burden, let me tell you, 33%, that is almost a third of cancers are tobacco-related cancers. That means tobacco and alcohol is a known causative factor for cancers in our Indian population. When that being the case, before that I just want to just briefly tell you about the tobacco-related cancers. What is tobacco and tobacco-related cancers? What are those basically? Tobacco-related cancers there are two types of tobacco-related cancers. One is smokeless tobacco, that is in the form of kaini, gudka, pan parag, and other things. Other is smoking tobacco, that is in the form of BDs, cigarettes, and nowadays it's what is that? There's a lot of bars, hookah bars, which is very common. So these are the two types of tobacco usage in India, the commonest. And there's one more type of smoking, that is passive smoking. You need not be an active smoker to get this disease. This what is called as a passive smoking. Passive smoking is what any person who is in the company of a smoker for a long time, he also is at a risk of getting a cancer. In fact, when it comes to passive smoking, it is more dangerous because you are not only inhaling the smoke, you are also inhaling the other bacteria and other germs which the active smoker has been using. So, smoking being the most commonest cause of cancer in India, we can prevent this by just making sure that you don't smoke, either in the form of smoking or smokeless tobacco. And nowadays, I'm sorry to say this, I've seen people, it has become a trend, especially among the young adults and women who have taken to smoking a lot. Whatever the reason might be, this is not the way for us or the young population of India to move ahead. As we grow, as we become a developed nation, it doesn't mean that we need to take into consideration all the habits of the Westerners. India has always been a rich cultural country. We need to stick to our basics, what our ancestors have been doing all these days. Let me tell you, nowadays there are a lot of changes in the physical activity also. Yes, India has progressed as an advanced nation, and the driving force of India is being the youth. And youth, I know we have become more intelligent, more actively intelligent, but when it comes to physical activities, we have gone back on our olden days. And these lifestyle habits leads to many other conditions. It's not only cancer. As whether you know this or not, America has the maximum population of obesity, and we are catching up with them very fast. Our population also is catching up with them very fast, and obesity leads to many diseases, including cancer. Because what obesity does is there can be insulin resistance, there can be hypertension, there can be diabetes, there can be hormonal changes, which is very important, especially for it is one of the causative factors for breast cancer. Just to put you into perspective about prevention, why it is important, you should know India, among the females, cervical cancer was the most commonest type of cancer which we used to see in India in the females till very recently. That was attributed to a poor hygiene as well as the HPV associated viruses. Now, very recently, this past 2 to 3 years, cervical cancer is not the leading cancer of death or leading cancers in women, it is the breast cancer. That's because, again, it's one of the reasons is, as I said before, it is the sedentary lifestyle, the lifestyle habits what we have adapted now. So this can be prevented, especially when it comes to cervical cancer. It can be easily prevented. The proof of the pudding is in 1980, number of cases what we used to see in stage 3 and stage 4 were 80 to 90% of the cases. Whereas today, the same stage 3 and stage 4 is less than 40 to 50% of the cases, cancer cases what we are seeing. This is because of two things. One is the awareness, one is the betterment of hygiene, as well as the patients coming and seeing the doctor at an early stage. I just don't want it to be a boring session, so now let me make sure that you are all involved. I know this is it's not a co-ed college. It is? Oh, nice. Nice to hear that then. Okay, because I'm seeing most of them are females. Yeah, okay. Nice then. Now tell me, how many of you know about cervical cancer? Raise your hands. 1, 2, 3, 4, and a handful. Right? Now tell me, how many of you know what is a causative factor for cervical cancer? Anybody? Okay, fine. It is basically 90 to 95% of cervical cancers are because of HPV, that is human papilloma virus, which causes cervical cancer. Now tell me, how many of you know about vaccination for the same? Again, I can see only a handful. Those who raised about cervical cancer, only them I'm seeing them. Now tell me, of these who have risen their hands, how many of you taken vaccination? Just 1 and 2. This shows our lack of knowledge, lack of awareness. To drive home the point, let me tell you, 90 to 94% of cervical cancers are due to HPV virus. This can be prevented totally. If not totally, at least 90 to 95% of it can be curbed or prevented if you just take a HPV vaccination. So, my first point, which I need to make sure that all of you take home, is make sure whatever the age is, the best age to take HPV vaccination. There are 2 types of vaccination. One is there can be a bivalent or a quadrivalent vaccination. The best time to take a vaccination is from 9 years onwards up to 14 to 15 years. Basically, what it means is before the first sexual activity, this vaccination needs to be taken. This is because, one more thing, because now they said there's a co-ed college. Let me tell you, the culprit for this cervical cancer or HPV is we, the men. Because it is through men that you get HPV infections. So I say now, since it's a co-ed college, even men are supposed to take HPV vaccination, and that too before they have their first sexual activity. So by doing this, 90 to 95% of cervical cancers can be prevented. Now tell me, Mrunalini madam was saying about her friend, that she complained of stomach pain, ಫಸ್ಟ್ ಮಗು ಆದಾಗ ನೋವು ಅಂತೇನೋ ಹೇಳಿದ್ರು ಅಂತ. ಆ ಥರ ನಮ್ಮ ತಾಯಂದಿರಿಗೆ ಎಷ್ಟು ಜನ ನಾವು ವಿ ಹ್ಯಾವ್ ಆಸ್ಡ್ ವಿದರ್ ವಿ ಹ್ಯಾವ್ ಟೇಕನ್ ಆಸ್ಕ್ ದೆಮ್ ಏನಾದ್ರು ತೊಂದರೆ ಇದೆಯಾ, ಏನಾದ್ರು ಪ್ರಾಬ್ಲಮ್ ಇದೆಯಾ ಅಂತ ಯಾರು ಕೇಳಿದೀವಾ? ಐ ಡೋಂಟ್ ಥಿಂಕ್ ಸೊ. ಕೇಳ್ತೀವಾ? ಡು ಯು ಟಾಕ್ ಟು ಯುವರ್ ಪೇರೆಂಟ್ಸ್ ಎನಿ ಟೈಮ್? ಡು ಯು ಎನ್ಕ್ವೈರ್ ಅಬೌಟ್ ದೇರ್ ಹೆಲ್ತ್ ಎನಿ ಟೈಮ್? Okay, if you enquire, make sure that small symptoms, small signs, what they're going to say, if it is persistent, I am not raising an alarm bell. I am not saying that all the signs, all the symptoms are cancer ಅಂತ ನಾನು ಹೇಳ್ತಾ ಇಲ್ಲ. ಯಾವುದೇ ಒಂದು ಸಿಂಪ್ಟಮ್ ಏನೇ ಇರಬಹುದು, if it is more than 2 to 3 weeks after seeing a doctor, after the initial course of antibiotics, if it doesn't subside, make sure you see an oncologist. In general, this is in general. Because any symptom which persists for more than 3 to 4 weeks, even after the routine normal treatment, is a cause for alarm. And the worst part, or I mean to say, tayandiru, females are so powerful, ಅದೇನೇನೋ ಬಂದರೂ ತಡ್ಕೊತಾರೆ. ದೇ ಡೋಂಟ್ ಇವನ್, their pain threshold is so high. In fact, the maximum, the most powerful and the most strength ಇರೋದು it's for the females, it's for the ladies and not for the gents. ಹಾಗಾಗಿ ಅವ್ರು ಏನೇ ಒಂದು ಸ್ಮಾಲ್ ಸಿಂಪ್ಟಮ್ಸ್ ಇರ್ಬೋದು, ಸೈನ್ಸ್ ಇರ್ಬೋದು, ದೇ ವಿಲ್ ನೆಗ್ಲೆಕ್ಟ್ ಇಟ್. ಅಂದರೆ ಫ್ಯಾಮಿಲಿ ಕಮ್ಸ್ ಫಸ್ಟ್, ಚಿಲ್ಡ್ರನ್ ಕಮ್ ಫಸ್ಟ್, and then rest, everything falls behind. This needs to change. So this is about, in general, about cervical cancer. Similarly, when it comes to oral cancers, that is tobacco related cancers, how many of you have told your male colleagues or female colleagues when they are smoking not to smoke? Only a few. And let me tell you, you are the driving force for everything. I believe Nari Shakti is the best Shakti for everything. You are not only the creator, but the destroyer also. So, you being women, you can make sure your colleague, be it a female, and more so if it is a male, make sure that they don't go into habits which cause problems to their health. So, I request each one of you to make sure that anybody smoking, anybody drinking, to be avoided. Again, the next question will be, people coming and saying to me, saying that, sir, ನಾನು ಯಾವತ್ತೂ ಕುಡ್ದಿಲ್ಲ, ನಾನು ಯಾವತ್ತೂ ಸಿಗರೇಟ್ ಸೇದಿಲ್ಲ, ಆದರೆ ನನಗೆ ಕ್ಯಾನ್ಸರ್ ಬಂದಿದೆ, ಯಾಕೆ? This one scenario. The other scenario is, ನನಗೇನು, ನಾನು ಎವ್ರಿ ಡೇ 10-20 ಪ್ಯಾಕೆಟ್ ಸಿಗರೇಟ್ ಕುಡಿತಾ ನನಗೇನು ಆಗ್ತಾನೆ ಇಲ್ಲ, ನನಗೇನು ಕ್ಯಾನ್ಸರ್ ಬಂದಿಲ್ಲ. ಸೊ ಹೌ ಡು ಯು ಎಕ್ಸ್ಪ್ಲೇನ್ ದಿಸ್? there's a lot, individuals are different, immunity is different, how individual reacts are different. Cancer is a multifactorial disease. It is just not only smoking or alcohol which causes cancer. It's a multifactorial causative factors which act. So one person need not be the same as the other. with this only in mind, this year's theme for cancer awareness is United by Unique. United by Unique ಅಂದ್ರೆ ಅರ್ಥ ಏನು ಅಂತಂದರೆ, each and every individual who has a cancer is different. Each and every individual story of a cancer survivor is different. Each and every individual, how he reacts to the same particular treatment is different. This is what, and because it is different, let me tell you, and the theme of what I'm saying, United by Unique another. Cancer doesn't look at whether you are the rich or you are the poor, whether you are from an influential family or not an influential family. It can strike anybody. So the goal of this, in fact, last year, this year and the next year's theme is United by Unique. The goal is to not only treat cancer as a disease, but treat the individual as a whole. There has to be a holistic approach for the treatment of cancer. It's just not the treatment what we are giving, it is also the psychological as well as the social well-being and the quality of life what we are going to give to the patient. That is the theme of the past 3 years, United by Unique. So, similarly, not as a, this came because I said, ಸುಮಾರು ಜನ ನಾನು ಕುಡಿತಾ ಇದ್ದೀನಿ ಏನು ಬಂದಿಲ್ಲ, ನಾನು ಕುಡ್ದೇ ಇಲ್ಲ ಬಂದಿದೆ. ಅದಕ್ಕಿಂತ ದಟ್ಸ್ ದ ರೀಸನ್ ಐ ಹ್ಯಾವ್ ಟು ಟೆಲ್ ಯು ದಿಸ್, ಸೇಯಿಂಗ್ ದಟ್ ಈಚ್ ಆ್ಯಂಡ್ ಎವ್ರಿ ಕ್ಯಾನ್ಸರ್ ಇಸ್ ಡಿಫ್ರೆಂಟ್, individual is different. The ultimate goal should be make sure that none of them, first it should be prevented. The second thing is, if at all it is proven, it has to be we have to make sure that it can be cured. The other thing I need to say is very clearly is cervical cancer alle. Why I am telling you this is, this message when you are going out, when you go out with this knowledge, when you spread this to the society or the community, I'm sure there are a lot of myths in cancer. There are a lot of enigmas in cancer basically. One of the enigma is when I keep seeing patients sitting in front of radiation oncology department saying that ನಮ್ಮ ತಾಯಿಗೂ ಗರ್ಭಕೋಶದ ಕ್ಯಾನ್ಸರು, ನಿಮ್ಮ ತಾಯಿಗೂ ಗರ್ಭಕೋಶದ ಕ್ಯಾನ್ಸರು, ಆದರೆ ನಮ್ಮ ತಾಯಿಗೇನು ರೆಸ್ಪಾಂಡೇ ಮಾಡ್ತಾ ಇಲ್ಲ, ಇವ್ರಿಗೆ ರೆಸ್ಪಾಂಡ್ ಮಾಡ್ತಾ ಇದೆ. Let me tell you, garbhakoshat cancer, your cervical cancer is just a broad heading. Basically, it is saying it's Karnataka. Garbhakoshat cancer, there are different types of histologies. It can be a squamous cell carcinoma, adenocarcinoma, or a sarcoma. So, squamous cell carcinoma responds very well, whereas a sarcoma doesn't respond very well. So, garbhakoshat cancer different histologies, different in a different way. Similarly, each individual's journey is different. Why I am telling you this is, when people saying that ಅದೇ ಸ್ಟೇಜ್ ಇತ್ತು, ಅದೇ ಗರ್ಭಕೋಶದ ಕ್ಯಾನ್ಸರ್ ನಮ್ಮ ತಾಯಿಗೆ ಆಗಿಲ್ಲ, ಅವ್ರ ತಾಯಿಗೆ ಆಗಿದೆ, is because of this. With this knowledge, why is important to you is, there is no generalized treatment and ಬರಲ್ಲ. It shouldn't be a carpet bombing ತರ. It should not be a carpet statement saying that cervical cancer stage 1 this is what is going to happen. No, it is not that. So ಹೀಗಿದ್ದಾಗ what is required of you is encourage the patients to say, or rather to take treatment whatever it is. Basically, whenever patients come to me and ask, patients ಯಾವ ಸ್ಟೇಜು, ಏನು ಟ್ರೀಟ್ಮೆಂಟ್ ಗುಣ ಆಗುತ್ತಾ ಇಲ್ವಾ, I just want to ask one thing for everybody, and I've been asking this also. ಯಾವುದೇ ಸ್ಟೇಜ್ ಇರ್ಬೋದು, the first thing is, are we going to treat them or not? If we are going to treat, then what is the point of thinking whether it is going to be cured or not? Yes, scientifically you want to know whether he or she is going to live or not, that is okay. But once we have decided to treat, that aspect of whether he or she will get cured or not should not be the reason for you to take a decision to treat or not to treat. That's what means. Let us not play God. I don't want to play God. Because each individual is different, how they respond is different. For example, ಸುಮಾರು ಜನ ಟ್ರೀಟ್ಮೆಂಟ್ ಹೇಳಿರ್ತೀವಿ ಟ್ರೀಟ್ಮೆಂಟು ಸ್ಟೇಜ್ 4 ಇದೆ, ಎಷ್ಟು ದಿನ ಇರುತ್ತೆ. ಬೈ ಟೆಕ್ಸ್ಟ್ ಬುಕ್ ವಿಲ್ ಸೇ 3 to 6 months ಅಂತ. ಬಟ್ ಪೇಷಂಟ್ ವುಡ್ ಹ್ಯಾವ್ ಸರ್ವೈವ್ ಫಾರ್ 2 to 3 years. ದೇ ಕಮ್ ಬ್ಯಾಕ್ ಆ್ಯಂಡ್ ಸೇ 2 ವರ್ಷ 3 ವರ್ಷದಿಂದ ಆರಾಮಾಗಿದ್ದಾರೆ ಎಂಥ ಡಾಕ್ಟ್ರು ಅಂತ. ಇನ್ಫ್ಯಾಕ್ಟ್ ಅದೇ ಉಲ್ಟಾ ವುಡ್ ಹ್ಯಾವ್ ಟೋಲ್ಡ್ ಸ್ಟೇಜ್ 1 ಶಿ ಇಸ್ ಕ್ಯೂರ್ಡ್, ಯು ಕ್ಯಾನ್ ಗೋ ಹೋಮ್. ದೇ ಕಮ್ ಬ್ಯಾಕ್ ಆಫ್ಟರ್ ಅ ಇಯರ್ ಆ್ಯಂಡ್ ಸೇ ಡಾಕ್ಟ್ರೆ ಕ್ಯೂರ್ ಅಂತಂದ್ರೆ ಸ್ಟೇಜ್ 1 ಇದ್ರೆ ವಾಪಸ್ ಬಂದಿದೆ. ಸೊ ವಾಟ್ ಐ ಆಮ್ ಟ್ರೈಂಗ್ ಟು ಸೇ ಈಸ್ ಈಚ್ ಇಂಡಿವಿಜುವಲ್ ಇಸ್ ಡಿಫ್ರೆಂಟ್. ಇಟ್ ಹ್ಯಾಸ್ ಟು ಬಿ ಟ್ರೀಟೆಡ್ ಡಿಫ್ರೆಂಟ್ಲಿ, ಇಟ್ ಹ್ಯಾಸ್ ಟು ಬಿ ಸೀನ್ ಡಿಫ್ರೆಂಟ್ಲಿ. ಎಕ್ಸಾಮ್ ಇದು ಹೆಂಗೆ ಬಂದು ಕೇಳಿದಾಗೆಲ್ಲ ಹೇಳ್ತಾರೆ ಅವ್ರ ಗುಣ ಆಗುತ್ತಾ ಅಂತ. ಇಟ್ಸ್ ಲೈಕ್ ಆಸ್ಕಿಂಗ್ ಬಿಫೋರ್ ರೈಟ್ ಇವನ್ ಬಿಫೋರ್ ಟೇಕಿಂಗ್ ಅನ್ ಎಕ್ಸಾಮ್ ರಿಸಲ್ಟ್ಸು ನಾನು ಫಸ್ಟ್ ಕ್ಲಾಸ್ ಬರ್ತೀನಿ ರ್ಯಾಂಕ್ ಬರ್ತೀನಿ ನಾನು ಕೇಳಿ ನನಗೆ. ಯು ಹ್ಯಾವ್ ಟು ಟೇಕ್ ಅನ್ ಎಕ್ಸಾಮ್ ಆ್ಯಂಡ್ ದೆನ್ ಓನ್ಲಿ ಯು ಹ್ಯಾವ್ ಟು ವಿಲ್ ನೋ ವಾಟ್ ಇಟ್ ಇಸ್ ಆ್ಯಂಡ್ ಲೆಟ್ ಇಸ್ ನಾಟ್ ಪ್ಲೇ ಗಾಡ್. ದಟ್ಸ್ ವಾಟ್ ಐ ಸೇ ಟು ಈಚ್ ಒನ್ ಎವ್ರಿ ಒನ್ ಆಫ್ ದೆಮ್. So there are 2 things I said. One is prevention, the other one is treatment. When it comes to treatment again, I'm not going to take much time, another 5 to 6 minutes. I'm going to end my talk. First is prevention. There are preventable cancers. Oral cancers can be prevented because of tobacco. 33% of the patients are tobacco related. Andre 100 33 cancer is because of tobacco. Tobacco bitre again. That 100 has become 67. The next is about cervical cancer. That also, one cervical screening agirbodu, pap smear agirbodu. Okay, how many of you have got cervical screening done to your parents? One. Okay, because we don't tell them. When you go home today, my request to all the students is talk to your mom. I know it's an invasive procedure. Nam tayi adrunu she will not agree for this. ನನಗೇನೇ ಆಗಿಲ್ಲ ನಾಯಕ್ ಬಂದು ತೋರಿಸ್ಕೋಬೇಕು. ಬೇಡವೇ ಬೇಡ, ಬೇಡ ನನಗೇನಾಗಿದೆ, this is going to happen. But let me tell you, get her examined at least once a year. Yes, it's invasive to our privacy. Yes, it's not nice. They don't feel comfortable. Agreed. But ಒಂದನ್ನು ಅದೊಂದನ್ನು ಮಾಡಿದ್ರೆ you never know. You will be saving or you will be deducting. Or if she is okay, fine, excellent. At least you can be in peace. Because by doing this, I'm sure you will make a difference. Take it from me. Go home. Ask your parents. Talk to them. ಫಸ್ಟಲ್ಲಿ ನಮ್ಮ ತಾಯಿನೂ ಒಪ್ಪಲ್ಲ, ಯಾರ ತಾಯಿಂದರೂ ಒಪ್ಪಲ್ಲ ಅಂದರೆ ಒಪ್ಪಲ್ಲ. ಬಟ್ ಇಟ್ಸ್ ಆರ್ ಡ್ಯೂಟಿ ಟು ಮೇಕ್ ಶ್ಯೂರ್ ದ್ಯಾಟ್ ವರ್ಷದಲ್ಲಿ ಒಂದು ಸಲ ಅಟ್ಲೀಸ್ಟ್ ಒಂದ್ಸಲಿ ಎಕ್ಸಾಮಿನೇಷನ್ನು ಗೈನಕಾಲಜಿಸ್ಟ್ ಅಂತ ಮಾಡಿಸ್ಕೊಳ್ಳಿ. ದ ಅದರ್ ಒನ್ ಇಸ್ ದ ಬ್ರೆಸ್ಟ್ ಕ್ಯಾನ್ಸರ್. ಬ್ರೆಸ್ಟ್ ಕ್ಯಾನ್ಸರ್ಗೆ ಜಾಸ್ತಿ ಏನು ತಲೆ ಕೆಡಿಸ್ಕೊಳ್ಳೋವಂಥ ಅವಶ್ಯಕತೆ ಇಲ್ಲ. ದ ಸಮಥಿಂಗ್ ಕಾಲ್ಡ್ ಎಸ್ ಬ್ರೆಸ್ಟ್ ಸೆಲ್ಫ್ ಎಕ್ಸಾಮಿನೇಷನ್. ಅಂದರೆ ತಮ್ಮ ಬ್ರೆಸ್ಟನ್ನು ತಾವೇ ತಿಂಗಳಿಗೊಂದ್ಸಲಿ ವಾಟ್ ಯು ಹ್ಯಾವ್ ಟು ಡೂ ಇಸ್ ಒನ್ ಈಸ್ ಇನ್ಸ್ಪೆಕ್ಷನ್, ಒನ್ ಈಸ್ ಪ್ಯಾಲ್ಪೇಷನ್. ಅಂದರೆ ಒಂದು ಇನ್ಸ್ಪೆಕ್ಟ್ ಮಾಡೋದು, ಇನ್ನೊಂದು ಪ್ಯಾಲ್ಪೇಟ್ ಮಾಡ್ಕೊಳ್ಳೋದು ತಿಂಗಳಿಗೊಂದ್ಸಲಿ. ಪ್ರಿಫರಬ್ಲಿ ನಾಟ್ ಡ್ಯೂರಿಂಗ್ ದ ಪೀರಿಯಡ್ಸ್ ಆದಮೇಲೆ ಸ್ಟ್ಯಾಂಡ್ ಇನ್ ಫ್ರಂಟ್ ಆಫ್ ದ ಮಿರರ್. ಜಸ್ಟ್ ಯು ಹ್ಯಾವ್ ಟು ಲುಕ್ ಎಟ್ ದ ಶೇಪ್ ಆಫ್ ದ ಬ್ರೆಸ್ಟ್, ದ ಸೈಜ್ ಆಫ್ ದ ಬ್ರೆಸ್ಟ್, ಸಿ ಇಫ್ ದರ್ ಇಸ್ ಎನಿ ಡಿಸ್ಕಲರೇಷನ್ ಇನ್ ದ ನಿಪ್ಪಲ್ ಆರ್ ಆನ್ ದ ಸ್ಕಿನ್ ಆಫ್ ದ ಬ್ರೆಸ್ಟ್. ನಾನು ಹೇಳ್ತಿರೋದು ದಿಸ್ ಯು ಕ್ಯಾನ್ ಡೂ ಆನ್ ಯುವರ್ ಓನ್. ಇದು ಯಾರ ಹತ್ರ ಹೋಗೋದು ಬೇಕಾಗಿಲ್ಲ, ಏನು ಬೇಕಾಗಿಲ್ಲ. ಇಟ್ಸ್ ಆಲ್ ಯೂಶಲಿ ವಾಟ್ ಹ್ಯಾಪನ್ಸ್ ಇಸ್ ವಿ ಟೇಕ್ ಇಟ್ ಟು ವೆರಿ ಲೈಟ್ಲಿ. ನೀಡ್ ನಾಟ್ ಬಿ. ಎಕ್ಸಾಮಿನೇಷನ್ ಇಸ್ ಸೈಜ್, ಶೇಪ್, ಕಲರ್ ಡಿಸ್ಕಲರೇಷನ್, ಎನಿ ಡಿಸ್ಚಾರ್ಜಸ್ ಫ್ರಮ್ ದ ನಿಪ್ಪಲ್, ಎನಿ ಅಬ್ನಾರ್ಮಲ್ POD ಅವ್ರು ಏನಿದ್ರೆ ನಮ್ಮ ಆರೆಂಜಸ್ ನೋಡ್ತೀವಲ್ಲ, ಆರೆಂಜ್ ಸ್ಕಿನ್ ಇರುತ್ತಲ್ಲ, ಆ ಥರ ಏನಾರು ಇತ್ತು ಅಂದರೆ ಇಮಿಡಿಯೇಟಾಗಿ ಕಮ್ ಅಂಡ್ ಜಸ್ಟ್ ಶೋ ಇಟ್ ಟು ಅ gynecologist or a breast surgeon. By doing this is nothing. This is the minimum I'm saying. Yes, there is mammography, there is an ultrasound which needs to be done after certain years of age. More than 40 years ಆದರೆ once in a year ಮಾಡಿಸ್ಕೋಬೇಕು ಅಂತೆಲ್ಲ ಇದೆ. ಬಟ್ ಅಟ್ಲೀಸ್ಟ್ ಇದನ್ನು ಒಂದು ಮಾಡೋಕ್ಕೆ ಶುರು ಮಾಡಲಿ. ನಮ್ಮ ತಾಯಂದಿರಾಗಲಿ, all the female colleagues, make sure that you do this. Look at your body once in a while in front of the mirror once a month. That's all I'm saying. By doing this, your breast prevention, at least you can pick up certain things which looks to be abnormal. Breast ಆಯಿತು, oral cancers ಆಯಿತು, cervical cancers are. Of course, there are things like lung and colon, which screening can be done. Lung, sputum, just if there is a persistent cough for more than 6 weeks, not relieved by antibiotics, get a chest X-ray done, or a sputum for not only for AFB, even for malignant cells. That's all you need to do. Stool also. Similarly, colon cancer, stool examination, persistent constipation, bar diarrhea, which persists for more than 6 weeks and not relieved on medication, or any pain abdomen, get a stool examination done. Stool examination for malignant cells, you will be screening your own self. These are the main things where you can do it, where you can prevent or where you can pick up cancers in an early stage and treat. The last thing is about the treatment aspect. 1980s, just to give a perspective of what it is and where we have come out and why you should not lose hope. Cancer and ಬಂದಿದ ತಕ್ಷಣ ಕ್ಯಾನ್ಸರ್ ಮುಗೀತು ಅನ್ಕತ್ತೆ. No, it is not so. 1980s, 85, cervical cancer cure rates, stage 3, stage 4 was less than 40%. The same cervical cancer now, stage 3, stage 4, the cure rates are 70 to 80%. That means 100 ಜನದಲ್ಲಿ ಇದೇ ಟ್ರೀಟ್ಮೆಂಟ್ ತೊಗೊಂಡ್ರೆ ಕರೆಕ್ಟಾಗಿ 70 ರಿಂದ 80 ಜನಕ್ಕೆ ಗುಣ ಆಗುತ್ತೆ. Similarly, breast cancer cure rates in the last few decades was less, and it was only 5 years ಅಂತ 5 years survival rates ಅಂತ ಮಾತಾಡ್ತೀವಿ. But now breast cancer 5 year survival rates for any stage is around 60 to 70%. That means there is a lot of improvement, not only in treatments. There are a lot of new therapies which have come, be it radiotherapy, be it surgical robotic surgeries, be it immunotherapies or targeted therapies. Malignancy is a complex disease. Now we have gone to an era where that is called as personalized medication. Personalized medication ಅಂದರೆ ಆ ಮನುಷ್ಯನಲ್ಲಿರುವಂಥ ಆ ಸೆಲ್ಗೆ ಅದಕ್ಕೆ ಟ್ರೀಟ್ಮೆಂಟ್ ಕೊಡುವಂಥ ಪರ್ಸನಲೈಸ್ಡ್ ಮೆಡಿಸಿನ್. I will just not go into more scientific details. That's where we have come up to. So, one is screening, prevention, other one is treatment. The last aspect is the quality of life, and also when the way we look at patients. We don't now, it's no more treating the disease. Now we're treating, as I eventually said, the entire human being as such. It's not, cancer affects not only that person, but also his family and the caregivers. The idea now is to make sure everybody is well informed, including the caregivers, and there is both psychological support, social support, as well as affordability and accessibility to cancer treatment. That I'm very proud that the government of Karnataka is been doing through the insurance schemes for all BPL card holders, what is called as in ABRK, that is Ayushman Bharat Arogya Karnataka scheme. For any BPL, why I am telling this is, you any patients you know and they have been diagnosed with cancer, ಟ್ರೀಟ್ಮೆಂಟ್ ಕಾಸ್ಟಿಂದ ಟ್ರೀಟ್ಮೆಂಟ್ ಕೊಡ್ಸೋಕ್ಕಾಗಲ್ಲ ಅಂತ ಆಗಬಾರ್ದು ಅನ್ನೋ ಉದ್ದೇಶದಿಂದ ಯಾವ ಪೇಷಂಟ್ ಆಗಲಿ ಟ್ರೀಟ್ಮೆಂಟ್ ಇಲ್ಲದೆ ಹೋಗಬಾರ್ದು. ಆ ಒಂದು ರೀಸನ್ ಇದಕ್ಕೋಸ್ಕರ ನಾನು ಈ ಒಂದು ಮಾಹಿತಿ ನಿಮಗೆ ಕೊಡ್ತಾ ಇರೋದು. BPL ಕಾರ್ಡ್ ಪೇಷಂಟ್ಸ್ಗೆ ಕಿದ್ವಾಯಿಲಿ ಎವ್ರಿಥಿಂಗ್ ಈಸ್ ಫ್ರೀ. ಸ್ಟಾರ್ಟಿಂಗ್ ಒಂದು 150 ರಿಂದ 200 ರೂಪಾಯಿಗೆ ಏನು ಅವರು ಕಾರ್ಡ್ ಮಾಡ್ತಾರೋ ಅದು ಬಿಟ್ಟರೆ ರೆಸ್ಟ್ ಎವ್ರಿಥಿಂಗ್ ಈಸ್ ಫ್ರೀ ಫಾರ್ BPL ಕಾರ್ಡ್ ಹೋಲ್ಡರ್ಸ್. ಫಾರ್ APL ಕಾರ್ಡ್ ಹೋಲ್ಡರ್ಸ್ ಅಂದರೆ ಅಬೋವ್ ಪಾವರ್ಟಿ ಲೈನ್ ಕಾರ್ಡ್ ಹೋಲ್ಡರ್ಸ್ಗೆ 70-30 ಅಂದರೆ 30%, I think the 30% will be paid by the patient, the 70% will be taken care by the government. That is the scheme the government of Karnataka has got. Why I am telling you this is, cancer is a costly affair. The aim of the government as well as in Kidwai is to make sure any person coming to Kidwai should not go out of Kidwai without getting the right treatment. And it's not only the right treatment, the best treatment what is there in the entire world. Let me tell you, we have around 8 linacs in Kidwai itself. Just to tell you how advanced or how well equipped Kidwai is, we have 7 linacs in Kidwai itself, whereas in any other African countries, the entire country has only 3 linacs, whereas Kidwai itself has 7 linacs. That's what it is. Similarly, all treatments are free of cost. What is available in ABRK will be given free of cost. If there is any other treatment which is required, which is personalized, that you have to pay. For that also, we have made sure that we have got what is called as a KCDF, Kidwai Cancer Drug Foundation, where if the MRP is around 100 rupees outside, in KCDF, that is in Kidwai Cancer Drug Foundation, the same branded drug will be given to you for 40 rupees. 60 to 70% of the reduced price will sigate. With this, I would like to thank NMKRV College for giving me this opportunity, calling me to be a keynote, to give this keynote address. I'm sure I might have bored few, but it's my duty to do it. I have done it. Thank you.
Thank you very much, sir, for that insightful and deeply informative address. Your words have reminded us how awareness and informed choices, particularly regarding tobacco use, HPV vaccines, both in girls and boys, oral health, play a crucial role in cancer prevention and treatment. We are really grateful for your valuable time and for guiding us toward a more informed and responsible future. Thank you, sir.
As a small gesture of our gratitude and as a remembrance of your visit today, sir, may I request you to kindly accept a memento from our institution. Before we proceed further, on behalf of the organizing committee and everyone gathered here today, I would like to express our sincere gratitude to Dr. Naveen T. for sharing his expertise and inspiring us with his message on cancer awareness. Thank you, sir, for gracing this occasion with your presence. We wish you a wonderful day ahead.
I now invite Professor Tulchappa sir to share a few words with us.
Good morning, everybody. I was telling the organization, it's not my day, not my time to speak and give a lengthy talk. It is for the doctors to speak regarding cancer. Anyway, at the outset, I thank the RV Trust for having permitted me to sponsor the program as a calendar event every year. Now, Bhavani, my daughter, was a brilliant girl, a classmate of Dr. Muralini, Sneha, Basanti, who is in US, MIT, he is here. And she was afflicted with cancer, and she got, although she did BSc Biotechnology, MSc Zoology, MS Glasgow University in Bioenvironment, as Dr. Mulani told. Anyway, cancer will not leave anybody. Whatever highly qualified you are, and whatever you are, and that will catch you up for so many reasons. There are 101 reasons for cancer. And everybody is not an exception. Anybody can. My daughter Bhavani was telling, at the end, she was telling, I thank my oncogenes. I'm sorry, my oncogenes are expressing myself. Oncogenes have selected me to express themselves in my body. That is how she was taking. She was sportive all the time. Anyway, we lost her. Therefore, in the memory of my daughter, her classmates and our family has pulled up some money and then submitted to RV Trust. And the RV Trust is very kind enough to permit us to go ahead with this annual program. And it's a very, very important program to create awareness among the youngsters regarding the cancer. And as Dr. said already, Dr. Naveen said already, prevention is better than cure. One has to take prevention. And this is the time when you people think about so many reasons why the cancer is coming. And therefore, a lot of precautionary measures can be taken by you people now itself, from now itself, and spread the message. And I came to know that every year, there is a cancer detecting program from 10 a.m. to 4 p.m. and people are doing there outside. A big van has come with all instruments to detect cancer among the people, among general public and also the students. And generally the people come, some people come here around and get themselves examined for cancer. It's a good gesture. So I thank the authorities and the Department of Biotechnology. My daughter was very, very fond of biotechnology, Suman Madam, and Mrinalini, of course, she has already joined this department, her own classmate, and they are all taking a lot of interest to organize this program. And I thank the authorities once again for sponsoring the program. Thank you all very much.
Thank you, sir. I now thank Dr. Mahantesh sir for coordinating with all the arrangements made for today, screening, and making this event successful. We request you to kindly accept a memento from our institution, sir. Give a big round of applause. I would now like to share a brief highlight connected by today's program, that is poster competition announcement. A poster competition themed Fight Cancer with Knowledge, Not Fear was organized on 19th of February. We are delighted to receive nearly 20 enthusiastic entries reflecting creativity, awareness and scientific understanding. All the posters are displayed just outside this hall and I encourage everyone to take a few moments to view them on your back.
I would now request Professor Tuljappa sir, respected father of Bhavani ma'am, to kindly come forward and present the certificates to the winners as I announce their names.
First prize is awarded to Teja PS and Chitra Ji. Kindly come on to the dais. And the second prize goes to Sanjana Patankar and Ayushi Tiwari. बताता है ना.
The third prize shared jointly is awarded to Harshita and Parnavi.
Congratulations. Congratulations. Congratulations.
Thank you, sir. Congratulations to all the winners for their creativity, effort, and meaningful contribution towards spreading cancer awareness. Thank you, sir, for encouraging and recognizing the efforts of our students.
We have heard perspectives rooted in modern medical science, understanding cancer through clinical awareness and prevention. Healing, however, is a multidimensional journey. With this thought, we now move toward an Ayurvedic perspective on health and healing. I now invite Safura from second year BSc Biotechnology to introduce our next guest speaker, that is Dr. Ashwath Rao.
Good morning, everyone. It is an honor to welcome our distinguished guest for today's program, Dr. Ashwath Rao, Director of the Personalized Precision Health Systems Foundation. Dr. Ashwath Rao completed his MBBS from KMC Manipal and his Masters in General Surgery from Bangalore Medical College. He also serves as the Medical Director at the Center for Cooperative Medicine in Bengaluru. Often regarded as a leading voice in integrated medicine, Dr. Rao uniquely bridges modern allopathic science with the wisdom of Ayurveda, an influence deeply rooted in his family background. His pioneering work in this field has earned him immense recognition. Dr. Rao is a key investigation scholar in the Ayu Emergency Care Project, an initiative endorsed by the Ministry of Ayush. His work, documented by the Central Council for Research in Ayurvedic Sciences, highlights the life-saving potential of integrated medicine even in critical ICU settings. He has also contributed academically by editing a significant publication on the Ayu Emergency Care Project, reflecting his commitment to research, leadership, and innovation. We are honored to have such an inspiring medical professional and visionary thinker with us today. I request you all to join me in extending a warm and respectful welcome to our esteemed guest, Dr. Ashwath Rao.
Thank you, Safura. I would kindly request the guest, except Dr. Naveen sir, to occupy the seats in the audience so that we can begin the arrangement for the talk.
Is there in this now? ಹಲೋ ಇದು ಪಾಯಿಂಟರ್ ಏನಂತ ಅಥವಾ ಇಲ್ಲಿ ತೋರಿಸ್ಬೋದಾ ಹ್ಯಾಂಡ್ ಮೈಕ್ ಇದ್ರೂ ಪರವಾಗಿಲ್ಲ ಇದು ಈಸಿ ಸ್ಲೈಡ್ ನೆಕ್ಸ್ಟ್ ಜಸ್ಟ್ ಸ್ಲೈಡ್ ಅಲ್ವಾ ಸ್ಲೈಡ್ ಓಕೆ
Hand mic. Done.
ಫಸ್ಟ್ ಸ್ಲೈಡ್ ಹಾಂ ಸ್ಲೈಡ್ ಮಾಡಿದ್ರೆ ಬರುತ್ತಾ ಓಕೆ ಓಕೆ ಥ್ಯಾಂಕ್ ಯು Namaste everyone, good morning. I would like to express gratitude on behalf of Saukya Bharati Healthcare to the organization NMKRV College and the organizers and the teachers here who had personally come to our center and taken the trouble to coordinate the program. We would like to thank them for taking time out of their busy schedule to organize such an important yet it is very fearful topic to even discuss for many. But we would like to make you comfortable by the end of this webinar or this small discussion that it is not a thing to run away from either discussion or treatment or talking about it. And at the same time, there are many things which can be a pathway to get out of this, the so-called deadly problem. We will be even discussing about those small things which can make a big difference in such a disease. And it is very important to even discuss about the possibilities other than the conventional modalities also. As we know, many a times we discuss about the protocols set for any treatment. In many situations, in a disease like cancer, the protocols may fail to work in many situations. At that point of time, the treating doctor will desperately look for solution from any corners of the world so that the patient will be benefited. This is one such disease where in emergency, in ICU or in cancer treatment, the options are limited in many situations. And we are actually, I hope many of you are aware of different systems of medicine like Ayurveda, homeopathy and allopathy, different systems of medicine. And we all today should accept that different systems of medicine, they have their own limitations. They have their own strengths. You may be aware that in India, the death rate during COVID time was the lowest when compared to the population and the number of deaths that happened, when compared to even developed countries. So what I'm trying to convey is the more we become developed or the more wireless technologies we have, it is less likely that relying only on that, we may not have a solution. And at the same time, as Sir rightly said during the initial talk, Dr. Naveen said, we need a holistic care. So this holistic care does not limit us to only keep the discussion only for counseling or emotional support, etc. But at the same time, think from different systems of medicine's perspective, what can be done in such situations. So keeping this idea in mind, as a surgeon today, growing up in a family of Ayurveda, my parents are Ayurveda doctors. My father, Dr. Ramesh Rao, he has done both the course, Ayurveda and allopathy. So since childhood, they had trained me how to see the disease from different systems of medicine perspective. And taking the permission of my seniors who are seated here, I would like to continue the discussion. They are my mentors. Dr. Devjyoti sir, he is a senior surgeon in Delhi. Dr. Eric from US, Dr. Sujata madam, Dr. Sri Kumar sir, and my team members, and Dr. Sujata madam and Dr. Ramya madam, our senior consultants, and my friends. We all work as a team to achieve this purpose today, and introducing the concept of cure. What is the concept of cure? As sir rightly mentioned, early diagnosis will actually cure the disease. Whatever medicine a person might take, it can be either Ayurveda or homeopathy or chemotherapy. Early diagnosis is the cure. Recently I had a patient whose cousin brother's son, he was just 26 years of age. And the moment he got to know he has stomach cancer, within 2 days he committed suicide. Why? Because people think that the moment they are diagnosed with cancer, death is certain, but that is not the situation. Early diagnosis of any cancer, the possibility of cure is very high. So, the diagnosis of cancer will not decide the fate, but in which stage the cancer is diagnosed will decide the outcome of any treatment modality. It can be any medicine given. The burden is less, the outcome is much better, the duration of treatment is less. So, not only early diagnosis, today screening programs are done for breast cancer and cervical cancer. Screening programs are done. The same time, Ayurveda, when we plug in with this traditional system of medicine, what the traditional healing systems have to offer, like Ayurveda, Siddha, homeopathy, etc., we can even prevent the disease. Even before a person is born, we can prevent the disease. So you can, I will not touch on the topics which I have already given as a part of the content in the pamphlet what we distributed today. We have given a side heading of Garbha Samskara. What is Garbha Samskara? Before before husband and wife, before they plan for pregnancy, 3 months before that, if they are able to follow a particular diet chart and if they are able to detoxify the body, research has shown that how the genes which can cause trouble to the offspring can be filtered away and only healthy genes can be passed out. This is a concept of Garbha Samskara which we have to inform our relatives, cousins or our family members. Ayurveda offers prevention even before the person is born. So it is not about 20 to 30 years of age we have a sedentary lifestyle, then we start going to gym or doing yoga. We are not going to change what a person can have by the age of 50 years of age. So prevention begins as per Ayurveda even before birth. So you can read more about Garbha Samskara. What is it? Very interesting. We offer it in our center where they say my father or mother is a diabetic and I don't want my son or myself to get the same disease. Now we are discussing the same, extending the same thing for cancer. Now previously how we were preventing the hereditary risk of transmission of diabetic or hypertension or any other problem. Similarly now we are worried about prevention of cancer. So in that aspect, clubbing this modern technology of early diagnosis through screening by preventing, applying the principles of Ayurveda will be very helpful. As we know, food, thought, environment can be roughly divided as the 3 causes of any disease. And what is our role? Other than doctors, other than these screening programs, all of us can play an important role by educating others and avoiding self-medication. It can be any medicine because many people think Ayurveda and yoga, they don't have any side effects. You can go through some forwarded WhatsApp videos, YouTube videos, Facebook, and start taking some kashaya or some things can help you prevent things. So these things can be dangerous in the long run. I will give an example. Even turmeric, we know it is a very good medicine with anti-cancer potential. But with a person who has a tendency for severe gastritis, he can start vomiting. Now people have started asking cancer patients, they say, now Lakshmana Pala tinboda keltar actually, cancer is ಒಳ್ಳೆದಲ್ಲ ಅಂತ. So like that, many things are prevalent in the social media which will actually not benefit the person. In fact, it can trouble the person. So creating awareness about these simple things in your diet is very important, and you should not do anything without the suggestion of your treating doctor who is a qualified Ayurveda doctor. And lifestyle modification. Now we know that US people have replaced this name with fortnightly gastrointestinal deprivation. And they are trying to take patent for this, what our grandparents were doing. And why this is important, we will get to know in the next slide. And pranayama, they have relabeled as cardiac coherence breathing. What we actually practiced, people are trying to take patent and sell it back to us. We should discuss about these things today. I am not discussing much about the things which already you know about cancer. These are some things which can actually, when practiced throughout years, can put a very strong foundation to prevent cancer. And when I was doing my MBBS in Manipal, I had my friend who had come from Germany. He was doing his MBBS in Germany, and his physiology professor, they have internship programs for which they had to travel outside the country. So he selected Manipal University, and surprisingly, he did not go to allopathy department for his internship. He came to Ayurveda department. So I was going there. We had a combo card when I was doing my MBBS. I was going for massage every week, etc. There I met him. Surprisingly, he came to India. He is an MBBS graduate in Germany. He was pursuing his post-graduation. He came to India to study Ayurveda and visited our home. And surprisingly, when he went back, if you see his book rack, once he is back to Germany, he is sending me all Charaka Samhita, Shushruta Samhita, all these books translated to German. He started reading those books. And what will happen after 5 years? They will get Nobel Prize. You can see here, in 2017, for example, when we don't read our books, we have learned this in the history also. People from outside the country, they read our books, they propose things, they get Nobel Prize. they get out a product and we pay price for it and purchase it. So before this happens, we should not hesitate to say that if there is a cure through any way, that to our traditional system of medicine, we should be able to say that this works and say that this is ours. Otherwise tomorrow we'll be restricted from using our own medicine because someone else has taken patent for it. And this was about autophagy, how upas are depriving the body of, because we have the habit of, when we are hungry now, there is Zomato, Swiggy, etc. We can order and we can get it any point of time. We are not allowing our body to become hungry and eat. Many times you eat because you are with your friends and you're not hungry because it is time you eat. You eat because it is time and it is easily available. It is not the same condition for our parents. So that when you eat when you are hungry, and when you fast once in a while, like Ekadashi Upavasa, our body will initiate a process known as autophagy. The cancer cells will be committing suicide. So this theory was postulated, which is already mentioned in Ayurveda, but that postulation got Nobel Prize. Then they said this was already mentioned in Ayurveda. So without our knowledge, what I'm trying to say is, these small things which is practiced on a day-to-day basis in your home, this is more than enough in many situations to prevent cancer. And today what we present to make sure that we retain the pride in what we do, and tomorrow we should say that this is ours, and retain the patent or whatever it's with us. We present the result what we get through this cooperative model to combining Ayurveda, surgery, etc. We present it in our international platform also. And surprisingly, they are all actually looking for this, because in India we have the best of healthcare system when it comes to allopathy or Ayurveda or any system of medicine. But unfortunately, we are not clubbing the two things. This has to happen. And if this happens, which will happen shortly, because that awareness about that integration or the two systems coming together is gaining popularity, there is no doubt that we will become a Vishwaguru in healthcare. And this is the place where I did my MBBS in Manipal. We were discussing about this, and if you see other staff in blue uniform, they are from emergency medicine faculty. I'm sure that many of you have the perception that Ayurveda can treat only chronic condition like joint pain, or it takes 2 to 3 months to get the result, etc. Ayurveda cannot be used for emergency conditions. But as a surgeon, I have used Ayurveda medicine in intensive care units when the patient is gasping during COVID time. Ayurveda medicine in ICU has delivered result when our modern medicine protocol failed. So this discussion, how to expand this benefit to a greater population or a greater number of individuals, the discussions keep happening among our fraternity. If you see the person in the left corner, blue shirt, he is a unique person. He has done BMS MD and MBBS MD. He has done both the course. So we have such people with like-minded or with same intentions. We come together and discuss how the strengths of different systems of medicine in our country can be made use of, which is actually able to deliver much better result than the Western population. And now, when patients come to our clinic, they ask, is Ayurveda evidence-based? Because people think modern medicine is evidence-based. So, first of all, I would like to educate everyone, what are the 3 pillars of evidence-based medicine? Now, everyone wants to know evidence. If I say something, you need proof to follow. Or many of the scientific fraternity, they demand for evidence. Can you give some evidence? And WHO, they are the people who usually propose this evidence-based medicine for anything to follow. For example, after trial for 20 years, they said that Western commode is not good, Indian toilet is better. They said they spent 1,000 crore. My friend Dr. Nirmal, who is a nanoscientist, he was telling that they spent 1,000 crore to say that human milk is best for a newborn, which any other animal would know. We spent 1,000 crore for that. So we don't need any trial for that. So what I'm trying to say is WHO has clearly mentioned that in any country like India and China, where there is a rich background of traditional medicine, evidence-based medicine has to be carefully analyzed. We cannot force the person because there is some protocol made in the US, when something else better than that may be available in that place. So the 3 pillars or the 3 principles of evidence-based medicine, first thing, we all know clinical trial. We have to give the medicine and see how it works. If it works, then they get into the market. There are different stages of clinical trials, etc. This is one of the 3 aspect of evidence-based medicine. Second, very important the pillar of this is aspect of this is clinical experience. And third, patient preference. If the patient preference is not in the recommended protocol, and if the clinical experience is something else other than the recommended protocol, yet I am supposed to follow that, because clinical trial is not the only foundation for any evidence. Before talking about cancer treatment, we know we have to prevent cancer, and if the cancer is diagnosed, we have to cure the disease, we have to prevent, we know. But there are very few people actually discuss about these things which the service providers, we are not able to offer as of now. We have very strong protocols, but the patients are very weak, emotionally weak. I will tell you the incidence of a patient who came to our center. She was just 46 years of age. She had a 14-year-old daughter. She was asking us, and her neighbor has told her daughter that your mother has cancer, even you may get cancer. So because of this wrong information, they become emotionally weak. And the mother was telling that if I leave this place soon, what all things should I tell my daughter now itself? Those unnecessarily fear created because of wrong information through social media, neighbors, etc. will make the patient emotionally weak. And they suffer because of this anxiety. They have many other problems. They become diabetic, they become hypertensive, they become many other emotionally susceptible conditions. Unless we counsel the patients regarding the disease, what it is and what is the outcome and what needs to be done for the next generation, this emotional well-being of the patient is not addressed in the current clinical care. We say the survival has improved, but we don't say at what cost and what pain. As we know, the number of cancer cases is increasing day by day in younger population. And I will be quoting our Robbins pathology textbook, which says that, which quotes that 30 to 35% of the deaths in cancer patient is because of the side effects of the treatment what we give, either chemotherapy or radiation. So this is a quote from one allopathy book, what I am telling, which is our second year book. And as we know, many patients, they want to take help. If a person has fallen down and if he has fractured, immediately he will call his neighbor for help. But now cancer has become like a social stigma. They don't want their neighbors to know. So they hesitate to ask for help. This is actually delaying treatment. So this awareness about to remove this social stigma is very important. And they had to visit, you might have heard your friends or relatives, they traveled 1 year to the hospital to take the treatment. At that point of time, they could not do their routine job, and they lost their work because of that. And they could not get back to their same work. They had lost work for a few years of their career, which actually caused huge problem to their family, etc. When we think about cancer treatment, unless we discuss and support patients regarding these aspects, treatment will be less likely successful. Can I please know among the audience, how many of you think that chemotherapy and radiation is required to cure cancer, or with the support of Ayurveda? Or can I please know whether Ayurveda medicines alone can cure cancer? Does anyone have any idea about it or belief about it? So what I am trying to ask is, do you believe that whether Ayurveda medicine is given alone, or first of all we should know whether there is a medicine in Ayurveda for cancer, or does Ayurveda medicine alone can cure cancer? If yes, can I please know whether if anyone believes it is possible? Yeah, I can see few hands. So we are fixed in our mind that the moment a person gets cancer, they had to take that injection and radiotherapy to come out of cancer. And definitely we know that we always believe that emergency conditions cannot be handled by Ayurveda. If there is some chronic condition, we have to do some massage and treat the condition. Or if it's emergency, we have to send the patient to ICU and they will keep on ventilating. This is our imagination. But I want to give you an example of a case here who is an 11-year-old boy. I will tell you a very tragic story of this 11-year-old boy. Unfortunately, he is from northern part of Karnataka, and because of consanguineous marriage, his elder brother, he was born with blindness and he had pancreatitis. And his sibling, next sibling, she was a girl, she was fine. And the patient, this third person, 11-year-old, he was again a boy and he was absolutely fine. His health was absolutely fine. Until last year, in the year 2024, almost 2 years back, he was diagnosed with blood cancer. And his uncle at Manipal Hospital, Old Airport Road, who is a hemato-oncologist, very senior, reputed hemato-oncologist, is a person who treats only blood cancer. So he started treatment, but unfortunately within 1 week of diagnosis, this child lost his father in an accident. Then his mother and grandfather, they started treatment for 6 months. They gave chemotherapy for 6 months, and they said the child has successfully been treated. Even though he has become weak, he lost his immunity with repeated infection, and again there is a drug by name L-asparagines. Because of the side effect, he got pancreatitis, etc. But still, with the side effects of the treatment, his mother used to manage him, and they said everything is fine, and they sent back. But unfortunately, as sir said, many times we inform patient you are out of cancer, but it comes back within no time. So the disease came back similarly in this kid within 6 months of stopping the treatment. And as I said, the previous injection what was given, that caused side effect to the pancreas, and it caused pancreatitis, severe stomach pain, vomiting. He was not able to take any food. And again, his WBC count, white blood cell count, you may be aware that the normal is 4 to 10,000. It again started dropping, 3,000, 2,000, and when it reached 300, so then they said the cancer has been, it is relapsed. And when they again approached his uncle in Manipal Hospital in Bangalore, they said, even if you do bone marrow transplant, the child will not survive. And even if immunotherapy is given, which costs more than 50 lakh, he will not survive. So nothing can be done. So even before they reached the hospital, his uncle said, please don't get him to Manipal. And he was with the desperate pain. And everyone in village in Sindagi, Bijapur, they said, he will not come back. ಹುಡುಗನ ಅಜ್ಜ ಕಿಸ್ ಕೊಟ್ಟು ಬೆಂಗಳೂರಿಗೆ ಕಳಿಸಿದ್ರಿ, ಇನ್ನು ಅವನು ಬದುಕಿ ಬರಲ್ಲ ಅನ್ನೋ ಒಂದು ಇಂಪ್ರೆಷನ್ ಎಲ್ಲರಲ್ಲೂ ಕ್ರಿಯೇಟ್ ಆಯಿತು. ಸೊ ದೆನ್ ಹಿ ಕೇಮ್ ಟು ಬ್ಯಾಂಗ್ಳೂರ್ ಫಾರ್ ವಾಟ್? ಫಾರ್ palliative care or end of life care. He should die without pain. There is a purpose of sending him to Bangalore. And I will show you the video of that person when he came to Bangalore. Can you play the video if it's possible? Or can you go back? It is, yeah. And with pain, he was given morphine injection. Morphine patch. It's not an injection, but he was a patient who came to Kshema Hospice in JP Nagar. Hospice is a place where last stage cancer patients are kept to die without much pain. This was the situation of the patient when he came here. All the painkiller injections were given for 15 days, and because of the fear, he was not able to eat. He did not eat anything for 15 days. He was given just IV fluids. And within 15 minutes of Ayurveda medicines, the child slept without pain after giving Ayurveda medicine. None of the injections or even morphine patch helped from our modern medicine allopathy side for 15 days, but Ayurveda medicine helped in 15 minutes. And the same person, he woke up from sleep after 2 hours. For the first time in 15 days, he ate one ganji contract. And what about cancer? That is very interesting. As you are able to see, WBC count, total count, it was 1,490. It came to 350, 320. And with that desperation, he got back to end of life care to our center. And within 5 days, so we are able to see the WBC count from 300, it jumped to 6,200. And I never gave any allopathy medicine for his fever also. Fever and even pain was managed only with Ayurveda medicine in allopathy setup. This is what we are trying to do, this cooperative healthcare model, to give this medicine. Medicine kottu mane kalsakagalla Ayurveda medicine anna, because he needs close monitoring. During fever time, ಮಕ್ಕಳಿಗೆ ಯಾವತ್ತೂ ಡಿಹೈಡ್ರೇಷನ್ ಆಗುತ್ತೆ, ನೀರಿನ ಅಂಶ ಕಡಿಮೆ ಆಗಿ ದೇಹದಲ್ಲಿ ಕಿಡ್ನಿ ಫೇಲ್ಯೂರ್ ಆಗುವ ಸಾಧ್ಯತೆ ಇದೆ. ಸೊ ಮೈ ಅಲೋಪತಿ ಟ್ರೀಟ್ಮೆಂಟ್ ವಾಸ್ ಟು ಗಿವ್ IV ಫ್ಲೂಯಿಡ್ಸ್ ಆ್ಯಂಡ್ ಮಾನಿಟರ್ ಯೂರಿನ್ ಔಟ್ಪುಟ್, ಯೂರಿನ್ ಟ್ಯೂಬ್ ಹಾಕಿ ಎಷ್ಟು ಹೊರಗೆ ಬರ್ತಿದೆ ಅಂತ ನೋಡ್ಬೇಕಂತ. ದಟ್ ವಾಸ್ ಅವರ್ ಓನ್ಲಿ ಅಲೋಪತಿ ಟ್ರೀಟ್ಮೆಂಟ್ ಗಿವನ್. ಆ್ಯಂಡ್ ಆಫ್ಟರ್ 21 days, surprisingly, and his platelet was 20,000. If you see the report, platelet was 27,000. It has become 90,000 without giving a single drop of blood. And before coming to our center, he was given blood transfusion almost every day. Without the need to give any blood transfusion, any painkiller injection, we got the bone marrow biopsy done. And surprisingly, it is in remission. The disease which they said cannot be cured, let him die peacefully. We were able to get out of him of the disease in a span of just 3 weeks of time. And this is his father, mother and his sister, and with my team member Dr. Bhargav. We are seeing the patient when he got discharged. He was just 18 kg with emaciation. He just came out of the disease because of side effects of chemotherapy. He had colitis, indigestion, etc., which everything got corrected. And he went back to his native without informing his uncle, because he said, don't get the son to me, because he did not want to inform. As I am the old student of Manipal, I had good connections in the hospital, the staff who were working there. I took this bone marrow biopsy report to his uncle. And I was waiting for him. He was meeting some patients. And I told that this is the... And I showed him the report. He has Yara report on the Kelidra, because he thought the child has anyway passed away. He had spoken to his mother almost 1 month back. And such kids, they don't survive for more than 2 to 3 days. When the WBC count is 300, they die of infection. With that condition, I had shown in the very first video, they don't survive for more than 2 days. We expect the child to die in less than 48 hours of time. So he had no idea that the person is alive now. Forget about the cancer getting cured. They did not even think that the person was alive. Then I took this report to him. And what I feel is, when we get result, to people who work in big place, we should present it in a very humble way. Otherwise the ego will be hurt. So that is why I took this report to the hemato-oncologist and I said, this is your cousin's son's report. He said, I am not able to believe this report. This is unimaginable. And he said that even if I would have made the mother spend 50 lakh, he wouldn't have survived. And he thanked me for going and informing there, because during our MBBS days, we are brainwashed that whatever we do is ultimate. Nothing else outside this exists. So we are not trained to look outside what is possible in our capacity. And now he is sending patient. The news went to Narayan Hridayalaya. From there they are sending. From Sparsh Hospital they are sending. And once I told this news to his uncle, he went to Sindagi, to Bijapur, to attend a function. There he met the child's mother. And he went to his home. The same person now, he is now 32 kg. He completed his exams. And with his mother, and we were able to see the difference, how emaciated he was. And now he has completed 1 year of the treatment and still he is doing good. In many instances, we say the patient is 80 plus, 90 plus, we cannot give chemotherapy, mane karkondu hogi anta heltave. And this patient came from Kumta, they are native from Kumta, they went to Manipal, 86 ವರ್ಷದ ಅಜ್ಜಿಗೆ ಏನು ಮಾಡೋಕ್ಕಾಗಲ್ಲ, ಮಲ್ಟಿಪಲ್ ಮೈಲಾಮ್, ಇಟ್ ಇಸ್ ಅ ಫಾರ್ಮ್ ಆಫ್ ಬ್ಲಡ್ ಕ್ಯಾನ್ಸರ್. ದೆನ್ ದೇ ಕೇಮ್ ಟು ಕ್ಷೇಮ. ನಂತರ ಅವ್ರ ಮಗಳು 3 ತಿಂಗಳು ಬಿಟ್ಟು ಫೋಟೋ ಹಾಕ್ತಾರೆ ವಿತ್ ಅವರ್ ಗ್ರ್ಯಾಂಡ್ ಕಿಡ್, ಶಿ ಇಸ್ ಪ್ಲೇಯಿಂಗ್ ಕ್ರಿಕೆಟ್ ನೌ, ದ ಸೇಮ್ ಲೇಡಿ. As I mentioned earlier, the reason for death is not cancer alone, but even the side effects of treatment. So we had to give something. ಹೆಚ್ಚಿನ ಸಲ ಪೇಷಂಟ್ ಆಸ್ಪತ್ರೆಗೆ ನಡ್ಕೊಂಡು ಹೋಗ್ತಾರೆ, ಗೆಡ್ಡೆ 5 ಸೆಂಟಿಮೀಟರ್ ಇರುತ್ತೆ. ನಾವು ಕೀಮೋಥೆರಪಿ ರೇಡಿಯೇಷನ್ ಎಲ್ಲ ಕೊಟ್ಟಾಗ ಗೆಡ್ಡೆ 2 ಸೆಂಟಿಮೀಟರ್ ಆಗುತ್ತೆ, ಶ್ರಿಂಕ್ ಆಗುತ್ತೆ. ಆದರೆ ಓಡಾಡ್ತಿರುವ ಮನುಷ್ಯ ಹಾಸಿಗೆ ಹಿಡಿದಿರ್ತಾರೆ. ಸೊ ವಿ ಶುಡ್ ಟ್ರೀಟ್ ದ ಡಿಸೀಸ್ ಆ್ಯಂಡ್ ಆಲ್ಸೋ ದ ಪೇಷಂಟ್ ಆಲ್ಸೋ. ಸೊ ಟುಡೇ ವಿ ಆರ್ ಇಂಟ್ರೆಸ್ಟೆಡ್ ಓನ್ಲಿ ಕ್ಯೂರ್. ಗೆಡ್ಡೆ ಶ್ರಿಂಕ್ ಆದರೆ ಸಾಕು. ಆದರೆ ವಿ ಆರ್ ನಾಟ್ ಬಾದರ್ ಅಬೌಟ್ ದ ಪೇಷಂಟ್, ವಾಟ್ ಹ್ಯಾಸ್ ಹ್ಯಾಪನ್ ಟು ದ ಪೇಷಂಟ್, ನಾಟ್ ದ ಟ್ಯೂಮರ್ ಅಲೋನ್. ಸೊ ವೆನ್ ವಿ ಥಿಂಕ್ ಇನ್ ಸಚ್ ಲೈನ್ಸ್, ದಿಸ್ quote is very important, where the treatment itself is actually causing problem. And today I don't have to hesitate to say this, because even I am an allopathy person and surgeon, I don't have any hesitation to talk this, because the former director of Kidwai, Dr. Vijay Kumar, I am in touch with him. He has called me to Enopaya Hospital. I presented my cases. So because this applies to everyone, even if I take chemotherapy or if patients take, this rule applies to everyone. That is the reason everyone now, as a doctor sitting there in any hospital, they want their patient to get benefited. It does not matter what treatment is being taken. You might have heard that patients, they take Ayurveda medicine, they are fearful to tell there in big hospital because they were scolded. What picture you are having is something now 10 years back. Now the time has changed. People are looking for a solution. That too in a place like Bangalore. It is a very good place to get the best of the different treatment modalities under single roof. So we are actually discussing about the problems what we are facing, the limitations what we are facing, Today we may feel that the treatment is free, everything is getting cured. It is no. It's a big no. Big hospitals have come, there will be more patients, more suffering. And every system has its own limitation, and to plug in to that limitation and find a solution, we have different solutions. And how as a surgeon we can help our patients before and after surgery. Recently near there was a brand factory, now they have made ARC center near Kidwai. I operated a 86-year-old lady for breast cancer. And after surgery, she was angry and asking her son, ನೀವು ಸರ್ಜರಿ ಮಾಡಿಸಿದ್ಯಾ ಸತ್ಯ ಹೇಳ ಅಂತ. ಯಾಕಂದ್ರೆ ಸರ್ಜರಿ ಮಾಡಿದ ನಂತರ she has no pain. In fact, I took a back massage after surgery. I had back pain, but the patient has no pain after surgery. So, before and after surgery, when we give Ayurveda medicine, there is no need of antibiotic. There is no need of painkiller requirement. And I can show you one instance where during surgery, after surgery, after I put the suture, I use Ayurveda medicines. And this is one 86-year-old person after surgery, big surgery. Within second day, he is walking without any painkiller. Otherwise, we need to force the patient. They start taking food after 4-5 days. Slowly, they start walking after 1 week. And what is the definition of cure? ನಾವು ಯಾವಾಗ ಕ್ಯಾನ್ಸರ್ನ ಗುಣ ಮಾಡಿವೆ ಅಂತ ಹೇಳ್ಬೋದು ಅಂದರೆ, ಆಫ್ಟರ್ ವಿ ಟ್ರೀಟ್ ಕ್ಯಾನ್ಸರ್ ದ ಟ್ಯೂಮರ್ ವಿಲ್ ಡಿಸಪಿಯರ್. ಅಥವಾ ಕ್ಯಾನ್ಸರ್ ಗಡ್ಡೆ ಹೋದ ನಂತರ ಅದು 7 ವರ್ಷ ಬರದಿದ್ರೆ ಅದನ್ನು ಗುಣಪಡಿಸ್ತೇವೆ ಅಂತ ಹೇಳ್ಬೋದು. ಸೊ ಇಟ್ ಈಸ್ ವೆರಿ ಇಂಪಾರ್ಟೆಂಟ್ ಟು ನೋ ದಟ್ ಇನ್ ದ ಲಾಸ್ಟ್ 200 years, lot of rich heritage and documentation was destroyed in our country because of various reasons we all know. And now the time has come to document it again and say and re-establish the glory of our system of medicine. The time has come. What I am trying to say is, not only my parents or what we are doing, we have experts throughout the country who treat through this system of medicine, through Ayurveda. They treat their patients. ಹಳ್ಳಿಯಲ್ಲಿ ಪ್ರಾಕ್ಟೀಸ್ ಮಾಡುವಾಗ ಮೆಡಿಸಿನ್ ತಗೊಂಡು ಇನ್ಶೂರೆನ್ಸ್ ಇಲ್ಲ ಅಂತ ಬರ್ತಾರೆ, ಆಯುರ್ವೇದ ಮೆಡಿಸಿನ್ ತಗೊಂಡು ಗುಣ ಆಗಿ ಹೋಗಿರ್ತಾರೆ. ಅವ್ರು ಫಾಲೋಅಪಿಗೆ ಬರಲ್ಲ, ಬಿಫೋರ್ ಅಂಡ್ ಆಫ್ಟರ್ ರಿಪೋರ್ಟ್ ಟು ಮೇಂಟೈನ್ ಲೈಕ್ ವಾಟ್ ವಿ ಡೂ. ವಿ ಸ್ಟಾರ್ಟೆಡ್ ಡೂಯಿಂಗ್ ಇಟ್ ರೀಸೆಂಟ್ಲಿ ಆಫ್ಟರ್ ಐ ಜಾಯಿನ್ MBBS. Otherwise, in a native place, they will take treatment and go back. They will not come for follow-up. So it is difficult to document. This is one such case which I documented. This is a case of throat cancer, what we say, vocal cord carcinoma, ಗಂಟ್ಲು ಕ್ಯಾನ್ಸರ್ ಅಂತ ಏನು ಹೇಳ್ತೇವೆ. He was a smoker. He went to Manipal and they said, ಕರೆಂಟ್ ಕೊಡ್ಬೇಕಂತ ಹೇಳುವ ಭಯ ಆಗುತ್ತೆ, ಜನರಿಗೆ ಬಿಟ್ಟು ಬರ್ತಾರೆ. So he came to my father. This is the biopsy report, CT scan, biopsy, everything is clearly mentioned. This is in 2015. He was a smoker. We know smoking causes lung cancer and throat cancer. And now the hoarseness of voice disappeared within 15 days after my father started the treatment. And now after 7 years, the CT scan was done in 2023. The person is absolutely normal, and this is the same person. We can say that even after 7 years, 8 years, 9 years, 10 years, the person is absolutely normal. So what I am trying to say is Ayurveda is not only offering temporary resolution of such solution for such critical condition, even for long term. There are hundreds of such success stories in our country treated by hundreds of Ayurveda doctors, but unfortunately we are not able to support them because they will get Ayurveda doctor, if he writes a prescription for CT scan, the hospital will not accept. They say nimma doctor the prescription tanni anta. So there are a lot of roadblocks to document the good work what is done in Ayurveda fraternity. We are trying to break those roadblocks and create evidence, and we don't talk out of enthusiasm or because it's 2000 years old. Once we get result, we should start following it. And before I end this session, I'm not trying to put one system of medicine either upper or lower, anything like that. Our idea is the two systems or different systems of medicine. We have come up with this 2-lung model. If 2 lungs like Ayurveda and modern medicine, if they work in synchrony, if they work with each other, the patient or the heart will be benefited. This is our idea of cooperative medicine. The 2 lungs cooperate with each other and breathe in a body. They support each other and they support the heart also. Similar idea has to be got in healthcare setup also. What I am trying to say is, ಕ್ಯಾನ್ಸರ್ ಬಂದ ಕೂಡಲೇ ಇಂಜೆಕ್ಷನ್ ಕೊಟ್ಟು ಕೂದಲು ಹೋಗ್ಬೇಕಂತ ಇರುವ ಅವಶ್ಯಕತೆ ಇಲ್ಲ. And it is not that we don't make use of chemotherapy and radiation. It is required only in minority of the patient, and there is no need to go to the hospital for months together, years together for every week's injection. Especially we are treating more number of breast cancer patients. And I was invited for a talk in Mangalore, and I had gone to my native place from Mangalore to Udupi. When I was driving, I saw 5-6 boards there. ಕ್ಯಾನ್ಸರ್ ಅನ್ನು ಗೆಲ್ಲಿರಿ ಅಂತ ಒಂದು ಹೆಂಗಸನ್ನ ಸ್ಕಾರ್ಫ್ ಅಲ್ಲಿ ತೋರಿಸಿದ್ದಾರೆ. ವಾಟ್ ಡಸ್ ಇಟ್ ಮೀನ್? Does it mean that if a woman gets any cancer, she has to lose her hair? The answer is big no. I can show you many cancer cases in our center. ನೋಡುವಾಗ ಸ್ಕ್ಯಾನಿಂಗ್ ಹೋದಾಗ when our patient they go for follow-up scan after 2 years, 3 years, the scan center is not ready to believe that they are cancer patient because they look normal. So then they had to get their biopsy report to prove that they are cancer patient. So there is no need to think of losing hair or having side effect. There is a way out through surgery and Ayurveda. And as I mentioned earlier, the side effects are because of chemotherapy and radiation in majority of the patients, but not through surgery. Surgery is something like we do for appendix or hernia. It will be such a small surgery even for cancer. But the problem starts in many patients during chemotherapy and radiation, which we are trying to avoid with the introduction of Ayurveda medicine, which is actually very much research-oriented medicine what we are offering today, for which R&D is done, safety profile, everything, the standard what has to be met for the safety or the efficacy is actually maintained because we don't prescribe medicine for any of a cancer patient. We prepare in-house and offer to make sure of the quality. And I'll be happy to answer if you have any queries or any your thoughts on this. We'll be happy to answer your doubts. Thank you. Thank you.
Hello, sir.
Please, yeah.
Sir, what is enlargement of uterus, sir?
Yeah, please sit, yeah. You asked about enlargement of uterus, right?
Yes, sir. I have heard that like the people who have like the women whose uterus has been enlarged is prone to cancer, sir. So
Yeah.
my question.
Yeah, please sit, yeah. So, as you mentioned, enlarged uterus can be because of many reasons. Because of the hormone imbalance in the body, it can be as simple reason as that, or it can be because of malignancy also. But if a woman has enlarged uterus, the chance of it being cancer is very, very less than even 0.001%. That is not the reason for cancer. And in majority of the cancer patients who have uterus cancer, their uterus is not enlarged. So you should not be bothered about enlarged uterus. But the more concerning feature, if I'm not wrong, Dr. Debjyoti sir, the bleeding or
whoever has told you that it is the enlargement of the uterus, it is not the enlargement, it is the thickening of the uterus. The thickened uterus in an ultrasound is a malignant or a pre-malignant condition. And the uterus doesn't enlarge, but there are tumors which makes an ultrasonologist feel that the uterus has become enlarged. So as such, uterus enlargement is not a risk factor. The thickening is the risk factor.
And in the ultrasound, they will usually mention the endometrial thickness is 6 mm, 7 mm, etc. Many times, if that is enlarged, and if the woman is having continuous bleeding other than the cycle, and if the patient is continuing to bleed after the menopause also, and if the bleeding is not stopping, irrespective of the medication taken, then it is a concern. As and sir mentioned, what they mentioned is the enlargement is of the inner layer of the uterus.
Sir, is Ayurvedic tablets cost effective, cost friendly? Sorry.
Yeah, it's a good and very good and a very relevant question also. Thanks for asking that question. Usually I mention in all the programs, but because of time constraint, I was supposed to finish by 12:30. As I was discussing with sir initially, it is very much cost effective when compared to chemotherapy and radiation. I was telling sir that, for example, in Ayushman ABRK schemes, what sir was telling, there is insurance coverage of 5 lakh. And if you go to Kidwai, a bone marrow transplant had to be done to that kid. Government would have sponsored 25 lakh, 50 lakh, etc. But for this kid, he had already spent 25 lakh in Manipal in a private setup. When he came to Ayurveda, we had spent, the patient had to spend 1.8 lakh, around 2 lakh. In that half of the amount, we had to sponsor from our pocket. So I'm in touch with many of the Rotary Lions, etc., many such NGOs who, with good heart, they would like to offer treatment to the big hospitals. For example, now the patient has finished a treatment in a government setup. He had taken 30 lakh treatment, which was covered through insurance. But when they come for Ayurveda treatment, they are not able to pay 30,000 per month because it is not covered under insurance. And through this result, we are actually informing the lawmakers and the people who can get the change that insurance involvement even for Ayurveda. And it is there for now. If you see all the insurance which your family members are covered, HDFC or any private or government insurance, it is covered for wellness. For massage, if you admit in government Ayurveda Medical College in Majestic, and if you take one massage for 8 days, 15,000 is covered. But not for such critical illness. When we treat in ICU for cancer treatment for 1 year, the patient had to spend maybe 2 lakh for 1 year. But one immunotherapy injection costs 2 lakh. That is covered under insurance. Today, I keep discussing this. Our Honorable MP, C.N. Manjunath sir, he went to Nirmala Sitharaman and discussed that all the tax for immunotherapy has to be reduced. We have influential people pitching for allopathy medicine, immunotherapy, but no one for Ayurveda. So our intention is now people who are influential, good-hearted, are donating. They should think how they can fund Ayurveda. So now, and what medicines, what we're giving for 30,000, it is not actually funded, and actually we spend from our pocket for R&D work. So when it is funded, it could further reduce to 10,000. Now we see the gold price has increased drastically when we use Swarna Bhasma based medicine. And to purify gold, we need mercury. The cost of that for 1 kg flask of mercury, what we get from outside country like Japan, the purification of gold, when we make Bhasma and to purify, we need mercury. The cost of 1 flask, 1 kg flask from 16,000 has gone to 38,000. Because government has done this because to avoid, you might have heard of Minamata poisoning in Japan because of mercury fish poisoning. Because of concern, they put the taxation on that so the utility is minimum. Somebody influential should pitch a voice that is you should, for Ayurveda manufacturers, there should be some exemptions. So if tax is reduced, it can be half of that. And I was invited at Global Ayurveda Festival in Trivandrum 2023. There we had Ayush Minister, all the Ayush ministers of different countries, like how we have Ayush ministry, even different countries like Bhutan, Myanmar and neighboring countries had. Their representatives in their setup, in their government setups, in their country, they give Swarna Bhasma based medicine for TB patients free of cost, which costs 100 rupees, if you see. But in Ayurveda, we don't offer that. It is not that we don't have the capacity, there is no right information and right vision when it comes to Ayurveda, because now we are actually happy that the Ministry of Ayush has been formed and we are exporting ashwagandha for wellness. We are now just, as my friend Dr. Eric was always telling, we are just happy that the export sales have increased post-COVID. We are not thinking what problem are we able to solve. We are having more number of people becoming diabetic at the age of 38, taking metformin in government setup. We have Janaushadhi Kendra. There are more number of people starting to take it, and it is available free of cost. So, as she rightly mentioned, the cost is now affordable when compared to chemotherapy and radiation, but it is not covered under insurance. So, it is a very big task to make it to reach out to people. Yeah, but it's only restricted, sir. For example, only for wellness. If you admit in any Ayurveda hospital, it is given only for weight loss, thyroid, for one program of detoxification, 20,000, 30,000. But if you say, I have to treat a patient with cancer, they say, as per protocol, you are supposed to take chemotherapy, so we will not give money for this. So now, the problem is, we are forced to take one thing. We don't have like in US, they are covered in their corporate insurance. They have to do what their company says. If they take something else, they're not covered under insurance. So today, our health is not under our control, unfortunately. And I don't want to deny that. I worked in Bowring and Victoria ICU during COVID time. I did not take any vaccine, COVID vaccine. At that point of time, in 2020, if we had said that it causes so and so problem, they would have said that you're a doctor, you say that vaccine is not required. Now we know the truth about vaccine. What all side effects it caused, we all have the proof. So, this is actually, we are forced. Then they said you cannot fly, you cannot travel without the letter, etc. No one can force us. So we should come out of that forceful deployment of treatment protocols Unless this happens, it is very difficult to get the right things for the person, what is required.
Sir, I had a question. Actually, previously you mentioned that there are side effects of taking chemotherapy and radiations. So is there any alternative in Ayurveda, basically?
Yeah. So, that's what we presented. The kid, what I said, he had taken chemotherapy with side effects. And when he started, and after 6 months, he had cancer, it has come back again, and the side effects. The kid had cancer and side effects together. And with Ayurveda treatment, his cancer got cured and his side effects also nullified. So the current understanding, if you see the discussion, if you have any family friends who are Ayurveda doctors, the concept is Ayurveda medicines to reduce the side effects of chemotherapy radiation. The principle is they'll keep on taking chemotherapy and radiation, and to reduce the side effects, Ayurveda medicines are given. This was the concept which is actually old in our understanding. Now we have gone one step ahead and we are seeing how to replace chemotherapy and radiation. Instead of giving chemotherapy radiation, causing the side effect and then treating the side effect, we are seeing how to replace it with Ayurveda medicine. And this is possible through our recent experience. And we may ask, if this is there, why this has not been possible so many years? Because if a patient comes to me, I am an Ayurveda doctor. If a patient comes to me for cancer treatment, for example, lung cancer, the patient can have breathlessness. He will need oxygen any time. If I give Ayurveda medicine, 1 month or 6 months later, if he has to go to the hospital, they will say, you have taken Ayurveda medicine. So now you did not take chemotherapy from us. It is difficult for us to admit you now. So till now, it is not about the lack of this efficacy of these medicines or lack of availability of this medicine, but there was no proper platform. That is the reason I saw this struggle, what my parents faced since a small kid, since a 4-year-old kid, I was going to my parents' clinic. It was a very tough time. We had the medicine, but when we want to admit the patient, how I admitted the patient and gave Ayurveda medicine. It is very important to create that ecosystem. When I admit the patient, I say that I don't want to give paracetamol for fever, I have to give this Ayurveda medicine. So this cooperative medicine approach is very much required. Otherwise, it's very difficult to start giving only Ayurveda medicine. That is why even if I'm an Ayurveda doctor and if the patient is my known person from 20 years, I cannot give Ayurveda because in case of admission, he is out of my control. So here we are in a situation that from Ayurveda OPD to surgery to ICU, we are one team managing and deciding what is good for the patient. And today, I feel what is missing or lacking in cancer care is we give the option to the patient. This is the Indian injection which costs 50,000 or imported 1,50,000. You decide what you want. So we did not spend our 3-4 decades of our experience to put it on patient's head. Today we decide what is good for the patient. And after MBBS, I took 2 years break. I was telling sir, I went to Rotary Alliance. After church morning prayer, my awareness program was there. We went to yoga class. So I spent 2 years after my MBBS to create awareness and say that and to inform people that we will decide what is good for you. Because today I listen to my legal team. We have a LLP company and our CA will decide how to do the finance, etc. I will not tell him you do like this. So when the patient comes to us, previously what I used to see during my childhood days is they were leaving it to the doctor to decide what is good for them. So that same thing we are doing for the patient. If chemotherapy is required, Ayurveda is required, surgery is required, based on our limited experience of 40 years, because medical experience even 100 days is not good enough. We need a collective and small experience of 10 people in our team. We sit and discuss what is good for the patient at that point of time. Now many patients call us and say, I will take chemotherapy, can you give side by side Ayurveda? So they already decided because someone said that Ayurveda cancer medicine illa ante, Ayurveda tumba time takolate ante, Ayurveda tumba slow. So Ayurveda slow alla, Ayurveda barud slow ಹೆಚ್ಚಿನವರು ಎಲ್ಲ ಕಡೆ ಟ್ರೀಟ್ಮೆಂಟ್ ತಗೊಂಡು ಆಗೋದಿಲ್ಲ ಅಂತ ಹೇಳುವಾಗ ಆಯುರ್ವೇದಕ್ಕೆ ಬರ್ತಾರೆ. ಆಯುರ್ವೇದಕ್ಕೆ ಬರೋದು ಸ್ಲೋ. ದಟ್ಸ್ ವಾಟ್ ಮೈ ಪೇರೆಂಟ್ಸ್ ಯೂಶುವಲಿ ಸೇ. Ayurveda is quick in result. You have seen that with proof. And we need platform to treat and good support from that allopathy infrastructure. ಬಿಕಾಸ್ ಈಗ ಅಡ್ಮಿಟ್ ಮಾಡೋಕ್ಕೆ ಆಯುರ್ವೇದದಲ್ಲಿ ಅಂಥ ಒಂದು ಕೆಪಾಸಿಟಿ ಇರಲ್ಲ ICU ಬೇಕಾದರೆ ಇಡೋಕ್ಕೆ. ವಿ ಹ್ಯಾವ್ ದಟ್ ಇನ್ಫ್ರಾಸ್ಟ್ರಕ್ಚರ್ ಇನ್ ಅಲೋಪತಿ ಟು ಅಡ್ಮಿಟ್ ಆ್ಯಂಡ್ ಡೂ ದ ಸ್ಕ್ಯಾನ್, ಡೂ ದ ಟೆಸ್ಟ್, ಟು ಗಿವ್ ದ ಟ್ರೀಟ್ಮೆಂಟ್. ಸೊ ಒನ್ಸ್ ವಿ ಹ್ಯಾವ್ ದಟ್ ಪ್ಲಾಟ್ಫಾರ್ಮ್, ದೀಸ್ ಮೆಡಿಸಿನ್ಸ್ ಕ್ಯಾನ್ ಬಿ ಗಿವನ್ ವೆರಿ ಇಫೆಕ್ಟಿವ್ಲಿ ಆ್ಯಂಡ್ ವೆರಿ ಈಸಿಲಿ.
ನಮಸ್ತೆ ಸರ್.
ನಮಸ್ತೆ.
ಈಗ ಆಯುರ್ವೇದದಲ್ಲಿ ವಾತ ಪಿತ್ತ ಕಫ ಬಾಡಿ ಅಂತ ಇರ್ತದಲ್ಲ, ಹಾಗೆ ಇರುವಾಗ ಕ್ಯಾನ್ಸರ್ಗೆ ಹೇಗೆ ಅದು ಟ್ರೀಟ್ಮೆಂಟ್ಗೆ ಹೇಗೆ ಸಹಾಯ ಮಾಡ್ತದೆ?
It's a good question. Yeah.
Thank you.
So we say that, as she mentioned, in Ayurveda, based on my limited knowledge, I will, with the permission of our seniors, I would like to just give you a implicit. So in modern medicine, as sir said, ಗರ್ಭಕೋಶ ಕ್ಯಾನ್ಸರ್ ಆದರೆ ಒಂದೇ ಥರ ಇರಲ್ಲ, ಬೇರೆ ಬೇರೆ ಥರ ಇರುತ್ತೆ ಅಂತ ನೋಡ್ತೇವೆ ಆ್ಯಕ್ಚುಲಿ. ಸೊ ಆಯುರ್ವೇದಲ್ಲಿ ನಾವು ಟ್ರೀಟ್ಮೆಂಟ್ ಕೊಡುವಾಗ, ಫಾರ್ ಎಕ್ಸಾಂಪಲ್ ಇನ್ ಬ್ರೆಸ್ಟ್ ಕ್ಯಾನ್ಸರ್ ದೇರ್ ಆರ್ 10 ವೆರೈಟೀಸ್ ಆಫ್ ಬ್ರೆಸ್ಟ್ ಕ್ಯಾನ್ಸರ್. ಸಣ್ಣ ಏಜಲ್ಲಿ ಬರುವಂಥದ್ದು ಟ್ರಿಪಲ್ ನೆಗೆಟಿವ್ ಬ್ರೆಸ್ಟ್ ಕ್ಯಾನ್ಸರ್, ವಿಚ್ ಆಲ್ ಹಾರ್ಮೋನ್ ರಿಸೆಪ್ಟರ್ಸ್ ವಿಲ್ ಬಿ ನೆಗೆಟಿವ್, ಪಾಸಿಟಿವ್ ಎಟ್ಸೆಟ್ರಾ. ಸೊ ಥ್ರೂ ದಿಸ್, why we categorize these cancers, garbhakosha cancer ಅಥವಾ breast cancer, thyroid cancer, based on their aggressiveness. So that's why because some cancers easily respond, some cancers they don't respond, and some cancers have different modalities of treatment, their way of treatment is different. We consider that aspect, consider the aggressiveness, consider the preventive medication to be given, understanding the complication in that disease. And at the same time, one patient ಬಂದರೆ ನಮ್ಮ ಸೆಂಟರ್ಗೆ ನಾವು ಅಲೋಪತಿ ಪ್ರಕಾರ ಏನೆಲ್ಲ ಸ್ಕ್ಯಾನ್ ಮಾಡಿದ್ರೆ ಎಲ್ಲವನ್ನು ಅರ್ಥ ಮಾಡ್ಕೊಳ್ತೇವೆ. ಅದೇ ರೀತಿಯಲ್ಲಿ ಆಯುರ್ವೇದದಲ್ಲಿ ಈ ಕಾಯಿಲೆನ ನಾವು ಯಾವ ರೀತಿಯಲ್ಲಿ ನೋಡ್ಬೋದು. ಫಾರ್ ಎಕ್ಸಾಂಪಲ್, ಇಫ್ ಯು ಸೇ ಬ್ರೆಸ್ಟ್ ಕ್ಯಾನ್ಸರ್, ಐ ವಿಲ್ ಕ್ಲಾಸಿಫೈ ಇಂಟು ER ಪಾಸಿಟಿವ್, HER2 ನೆಗೆಟಿವ್ ಕ್ಯಾನ್ಸರ್. But in Ayurveda, I say it is a kaphaja arbuda. Because of excess kapha in the body, that cancer has formed. But if that kaphaja arbuda, breast cancer, has gone to liver, I will say even there is pitta involvement. So our data upayoga madkondu sir, we fine tune the Ayurveda medicine. If it's aggressive tumor, I may have to give the medicine thrice a day, and what medicines I have to select. So we diagnose the disease based on modern medicine, based on Ayurveda, and then we select Ayurveda medicine, taking clue from both the system. So, and one extension of the question what he asked, for example, when I was, soon after I completed my MBBS, if you see in Amazon, there is a book authored by Dr. M.S. Valayathan. He is a Padma Vibhushan awardee. He is a cardiac surgeon, and he is the founder of Sri Chitra Tirunal Institute, you might have heard, in Tamil Nadu. And in 1980s, they were preparing heart valve and exporting it to Germany. And after retirement, most of the time, unfortunately, allopathy doctors, they realize Ayurveda is required after retirement. So where they translate books and have read his books, all the translated books, Charaka, Shushta, Vagbata, and you might have heard of endometriosis, the condition known as endometriosis. What happens in endometriosis? Instead of the menstrual blood going out, it goes back and gets deposited in the ovaries. This is known as endometriosis. You might have heard of some of your family friends going through this phase. For that, in modern medicine, there is no rule or there is no reason why it happens. There are few reasons, etc. But it's a puzzle. So if I read the same disease in Ayurveda, as you mentioned, we can say kapha, pitta, etc. Then they will say, what is the reason for that? They have clearly mentioned a woman who has too much of physical exertion during menstrual cycle, she will have endometriosis. This is not one of the reasons as per allopathy. And interestingly, when I ask such women, and some are marathon runners, they have the habit of trekking, etc. This is actually prohibited as per Ayurveda. During menstrual cycle, they are not supposed to physically strain them. This will result in, instead of menstrual blood going out, it will go back and get deposited in the ovaries and will lead to infertility, endometriosis, and it is such a severe, agonizing, painful condition. Many people undergo surgery. So this is one example how I gave you. When a patient walks in, as per modern medicine also we see, and some things we say idiopathic in allopathy, there is no reason as per modern medicine. But if you see the same disease in Ayurveda, there is a clear reason mentioned. So I need not believe because it is written, because we should believe because we are seeing the case. So that interesting correlation between the two systems, what I am trying to say is you should see the disease in different angles. This is based on my limited understanding. That's why now we have experts in our team. Dr. Sri Kumar sir, who is in our team now. I would like to thank you for being with us in spite of a busy schedule. Sir had his flight ticket yesterday. We had cancelled it and we made him go together. He is a legendary person who is known to treat. He is actually MD in Kaumara, like MD Pediatrics, who is specialized in Ayurveda treatment for pediatric condition. I have many patients from a special school in Chamrajpete with speech delay, autism, etc. Such patients, when they come here, because sir is visiting our center every week, and sir has a global center in his place where he has patients outside the country. Because in allopathy we have just behavioral therapy, speech therapy. There is nothing through medicine. Nimge namakarana maduva bhajan exidralva. You are aware of it. The same thing coupled with the Swarna Bhasma drops. Within 15 days we are able to see the improvement. It is given once, that's all. But if it is used as a treatment, what I'm trying to tell you is it is not only we give task to the skill improvement, etc., something physical activity. We don't have any medicine in that condition for kids. So such simple medicines in Ayurveda will actually avoid the number of people visiting the hospital. Now, instead of providing free treatment, today we felt through our Saukhya Bharati healthcare, after our talk, we should have less patients coming to our center because we have told you the home remedies. For example, that should be our idea. Instead of building new hospitals and giving free treatment, right? Because no one wants to be in ICU, there is free treatment. So we had to avoid patients coming to hospital, not creating the facility for free treatment. With this intention, we have set up this Saukhya Bharati healthcare. And ಇವಾಗ ಬೇಸಿಗೆಗಾಲ ಬಂದಿದೆ ಎಲ್ಲರೂ ಎಷ್ಟು ಜನ ಕೋಕಮ್ ಜ್ಯೂಸ್ ಕುಡಿತೀರಾ ಅಥವಾ ಕುಡಿದಿದ್ದೀರಾ ಆಲ್ರೆಡಿ? ಸಿ ಐ ಕ್ಯಾನ್ ಸಿ ಮೆನಿ ಹ್ಯಾಂಡ್ಸ್ ರೇಸ್ಡ್ ಹಿಯರ್. ಯಾ, ವೈ? ಬಿಕಾಸ್ ಐ ಆಮ್ ನಾಟ್ naming the person. She is actually nominated for Padma Shri. She is from Bangalore only. She is a very well-known nutritionist. She called me last year and she said, ತುಂಬ ಮೂತ್ರ ಊರಿದೆ, ನಾನು ಕೋಕಮ್ ಜ್ಯೂಸ್ ಕುಡಿದೆ, ಇನ್ನೂ ಜಾಸ್ತಿ ಆಯ್ತು ಅಂತ. I said, ಆಗದಿರತ್ತಾ ಮೇಡಮ್, ಅದು ಹೀಟ್ ಅಲ್ಲ ಮೇಡಮ್ ಅಂತ. So, but people drink it during summer, right? And she Google searched and sent a screenshot. I can actually put the photo, it is there in my mobile. The Google says, if you see, what is that kokum? It is a natural coolant. But my friend, Dr. Sriniket Adiga, he is actually expertise in Dravya Guna, Ayurveda pharmacology, especially plant-based. Actually, that is actually a kokum, is actually a heat to the body. How many of you know? Because we start drinking during summer. As per Ayurveda, kokum is heat. And you can give it to your friends or relatives who are having some burning sensation, urine infection irvaga, adannu kudsi nodi, you will feel that it will further worsen. So these small things actually, ಅವರು actually ಒಂದು ವಾರ ಕೊಡ್ದು ಇನ್ನೂ ಜಾಸ್ತಿ ಆಗಿ ಆಸ್ಪತ್ರೆಗೆ ಹೋಗಿ, so because of this wrong information what is circulating in a social media, small things what you feel is right may be detrimental for you. So the intention of our healthcare setup is to reach out to people and to make you aware of these small pitfalls in healthcare and how you should be careful. ನ್ಯಾಚುರೋಪತಿ ಅಂತ ಹೇಳಿ ಯೂಟ್ಯೂಬ್ ವಿಡಿಯೋ ನೋಡ್ಕೊಂಡು ನಾಳೆ ಫಾಲೋ ಮಾಡ್ಲಿಕ್ಕೆ ಹೋಗುವಂಥದ್ದು ಸರಿಯಲ್ಲ. That is very important. You should take the opinion of your nearby neighbor or friend who is a qualified Ayurveda doctor. Take their opinion. ಯಾರು ಉಪವಾಸ ಮಾಡಬೇಕು, ಎಲ್ಲರೂ ವೆಯ್ಟ್ ಲಾಸ್ ಆಗಬೇಕಂತ ಎಲ್ಲರೂ ಉಪವಾಸ ಮಾಡ್ಲಿಕ್ಕೆ ಶುರು ಮಾಡ್ತಾರೆ. ಗ್ಯಾಸ್ಟ್ರೈಟಿಸ್ ಇರೋರಿಗೆ ಇನ್ನೂ ತೊಂದರೆ ಜಾಸ್ತಿ ಆಗುತ್ತೆ. ಸೊ ಆಯುರ್ವೇದ ಸೈಡ್ ಎಫೆಕ್ಟ್ ಇಲ್ಲ ಅಂತ ಹೇಳೋದು ದೊಡ್ಡ ತಪ್ಪು ಕಲ್ಪನೆ. ಯೋಗಾಸ ಯಾರು ಮಾಡ್ಬೇಕು, ಮಾಡಬಾರ್ದು, ಯಾರು ತಗೊಳ್ಬೇಕು, ಇದೆಲ್ಲ ತುಂಬ ಸೂಕ್ಷ್ಮವಾಗಿ ಪರಿಗಣಿಸಬೇಕಾಗುವಂಥ ವಿಷಯಗಳು. ಅದನ್ನು ಮೆಡಿಕಲಿಗೆ ಹೋಗಿ ತಗೊಂಡು ಬರುವಂಥ ಒಂದು ಡೋಲೋ 650 ತಗೊಂಡಾಗೆ ತಗೊಳ್ಳುವಂಥ ವಿಷಯ ಅಲ್ಲ. ಸೊ ಇನ್ ಫ್ಯೂಚರ್ ಆಲ್ಸೋ ವಿ ಕ್ಯಾನ್ ಆ್ಯಕ್ಚುಲಿ ಕಂಡಕ್ಟ್ ಸಚ್. ಯು ಕ್ಯಾನ್ ಟೇಕ್ ಒನ್ ಟಾಪಿಕ್ ಲೈಕ್ ಥೈರಾಯ್ಡ್ ಆರ್ ಡಯಾಬಿಟೀಸ್. ಫಾರ್ ಎಕ್ಸಾಂಪಲ್, ಐ ವಿಲ್ ಗಿವ್ ಅವರ್ ಸೆಂಟರ್ ಇಸ್ ನಿಯರ್ ಲಾಲ್ಬಾಗ್. ಅಲ್ಲಿ ಶಿವಳ್ಳಿ ರೆಸ್ಟೋರೆಂಟ್ ಇದೆ. ಎಲ್ಲರೂ ಪ್ರಾಯದವರು ಶೂಸ್ ಸಾಕ್ಸ್ ಹಾಕೊಂಡು ಜಾಗಿಂಗ್ ಹೋಗ್ತಾರೆ, ನನಗೆ ಡಯಾಬಿಟಿಸ್ ಇದೆ ಅಂತ ಹೇಳ್ತಾರೆ. ಸೊ ದೇ ವಿಲ್ ನಾಟ್ ಟೇಕ್ ಕೇಸರಿ ಬಾತ್, ಶುಗರ್ ಇದೆ ಅಂತ, ಮತ್ತು ಮೊಸರು ವಡೆ ತಗೊಳ್ತಾರೆ. ಬಟ್ ಆಯುರ್ವೇದ ಕೇಸರಿ ಬಾತ್ ತಗೊಂಡಿದ್ರೆ ಪರವಾಗಿಲ್ಲ, ಮೊಸರು ವಡೆ ತಗೊಂಡಾಗ ಕಫ ಜಾಸ್ತಿ ಆಗುತ್ತೆ, ಶುಗರ್ ಜಾಸ್ತಿ ಆಗುತ್ತೆ. ಮತ್ತು ನಾನು ಶುಗರೇ ತಿನ್ನಲ್ಲ, ಶುಗರ್ ಹೇಗೆ ಜಾಸ್ತಿ ಇದೆ ಅಂತ ಅರ್ಥ ಮಾಡ್ಕೊಳ್ಳೋಕೆ ಕಷ್ಟ ಆಗುತ್ತೆ ಜನರಿಗೆ. ಸೊ ದೀಸ್ ಆರ್ ಆಲ್ ಸಮ್ ಪ್ರಿನ್ಸಿಪಲ್ಸ್ ಆಫ್ ಆಯುರ್ವೇದ which I applied in my clinical practice. Before I had to do surgery, I had to get the sugar under control. ಶುಗರೇ ತಿಂತಿಲ್ಲ ಅಂತ ಹೇಳುವಾಗ ದಿವಸಾಗ್ಲೂ ಮೊಸರು ತಗೊಳ್ತಾರೆ, ಉದ್ದಿನ ಮೊಸರು ತಗೊಳ್ತಾರೆ. The moment I stopped curd and urad item in their diet, the sugar has come down. There is no correlation between eating sugar and sugar being high. ನೀವೆಲ್ಲ ಕೇಳಿರ್ಬೋದು ನಿಮ್ಮ ಸಂಬಂಧಿಕರು, ಫ್ರೆಂಡ್ಸ್ ಎಲ್ಲ, ನಾವು ಶುಗರೇ ತಿನ್ನಲ್ಲ ಆದರೂ ಯಾಕೆ ಜಾಸ್ತಿ ಇದೆ ಅಂತ ಗೊತ್ತಿಲ್ಲ ಅಂತ. ಸೊ these are some things which we actually miss in our modern science, for which the clue is given through what our friend said, Vata Pitta Kapha. Through that we can understand the pitfalls which we are not able to understand and offer the solution accordingly. Okay.
Thank you, sir, for enlightening session. Your talk helped us appreciate how Ayurveda views health not merely as the absence of disease, but as a balance between body, mind, and lifestyle. We sincerely thank you for sharing your knowledge and experience with us today. Sir, I now request you to introduce your parents and the teammates, as we are really grateful for having them with us today.
My father, Dr. Ramesh Rao, he is with us, and my mother, Dr. Shobha Rao, she is currently in our native place. And he is an inspiration for me from childhood to talk the truth. It does not matter that if people are not following it. ಕೆಲವೊಮ್ಮೆ ನಂಗೆ ಸರಿ ಅಂತ ಅನಿಸಿದ್ದು, ಐ ವಾಸ್ ಹಿಯರಿಂಗ್ ದಟ್ previously there was some fear of conducting the program. ಈಗ ಕಿದ್ವಾಯ್ ಡೈರೆಕ್ಟರ್ ಬರ್ತಿದ್ದಾರೆ, ಆಯುರ್ವೇದ ಬಗ್ಗೆ ಮಾತಾಡ್ಬೋದು ಅನ್ನೋ ಭಯ ಅಂತ. ಸೊ ನಾನು ಕೇಳ್ಕೊಂಡೆ. ಸೊ ಮೆನಿ ಟೈಮ್ಸ್ ವಿ ಆ್ಯಕ್ಚುಲಿ ಫಿಯರ್ ಟು ಡೂ ದ ರೈಟ್ ಥಿಂಗ್ಸ್ ವಿಚ್ ನೋ ಒನ್ ಎಲ್ಸ್ ಇಸ್ ಡೂಯಿಂಗ್. ಎಲ್ಲರೂ ಮಾಡ್ತಿರೋ ತಪ್ಪನ್ನು ಮಾಡೋಕ್ಕೆ ಧೈರ್ಯ ಬರುತ್ತೆ, ಯಾರು ಮಾಡದಿರೋ ಸರಿ ವಿಷಯನ ಮಾಡೋಕ್ಕೆ ತುಂಬ ಹೆದರುತ್ತೇವೆ. ಸೊ ಟುಡೇ ಅವರ್ ಇಂಟೆನ್ಷನ್ ಈಸ್ ವಿ ಶುಡ್ ಸೇ ದಿಸ್ ಈಸ್ ರಾಂಗ್ ಇಫ್ ಇಟ್ ಈಸ್ ರಾಂಗ್, and we should say if it is helpful without any bias. So he is an inspiration for me from childhood to talk the truth whatever the results are. And we don't say that we offer cure 100%, we can cure the patient, but the intention is to decide ಈ patient ನಮ್ಮ ಮನೆಯವರಾದರೆ ನಾವು ಏನು ಟ್ರೀಟ್ಮೆಂಟ್ ಕೊಡ್ತೇವೆ ಅದನ್ನೇ ಕೊಡಬೇಕು ಅನ್ನೋದು ನಮ್ಮ ಉದ್ದೇಶ. And with that intention, we all, our team members at Saukya Bharati, we actually treat any patient as our family member, and we don't see that, because in big hospitals I have seen my friends, they prescribe many medicines to their patients. ಅವ್ರ ಮನೆಯವರಿಗೆ ತೊಂದರೆ ಬಂದರೆ ಏನಾದರೂ ಆಯುರ್ವೇದ ಇದೆ ಅಂತ ಕೇಳ್ತಾರೆ, who are working in Apollo Fortis. So such intention will not be able to give the best decision for the patient. I am thankful to him for giving me that courage since childhood to speak the truth. And I would like to introduce Dr. Sri Kumar sir. I told him about, he is a legendary person in treating pediatric conditions through Ayurveda. And Dr. Sujata madam, she is a BMS graduate, and now she is the one who introduced gene editing in plants. She is a scientist in US. It is because of the blessings and guidance of such people in our team, we youngsters are actually guided in the right path. And I would like to introduce Dr. Eric in our team. He is from US. Sir's father was a cardiologist in US, and sir is into Jyotishya and Ayurveda. And sir is a student of Padma Vibhushan N. Rajam, violinist, classical violinist. And sir has not studied this through a 4.5-year course. 25 years through Gurukula system. Sir has traveled throughout the world and studied about astrology, Ayurveda and classical medicine, and about Chinese medicine, Tibetan medicine. And sir's experience and guidance is helping us to shape the treatment in our center. Thank you very much for being with us. And I would like to introduce Dr. Debjyoti Sarkar sir in our team, whom we introduced initially. And we are actually, you can Google search Dr. K.S. Charak. Dr. K.S. Charak, he is our mentor. He is actually around nearing 70 plus now. He is a surgeon, and he is the head of Indian Medical Astrology. So, and his students today who are cardiac surgeons, neurosurgeons, they follow astrology. So, because the date of surgery, the direction of OT table, and when the surgery has to be done, all these things, if I do robotic surgery, it's not enough. What is the horoscope of the patient? What is my horoscope? Everything decides the outcome. And sir said many times, we asked, the treatment given is same. Some patients responded, some patients did not respond. And these are all not pseudoscience, because this is now being implemented in Mayo Clinic in US, MD Anderson. If you Google search, if you go to their main web page, there is something as Reiki Chikitsa. This is there in Mayo Science, Reiki Chikitsa in US. So whatever our Shastra has said, how we can incorporate to it. We have like our mentor Dr. Charak sir. He also visits our place once in a while, and he also our mentor. And to guide this, the two systems coming together without friction and with evidence. And sir is actually our, we are doing surgeries in the next week in Bangalore. If any complicated surgery, sir is helping me out in Bangalore. I would like to introduce Dr. Nirmal sir, who is a nanoscientist in our team, who was R&D head for Government of Kerala. And we know research, we had to pump in money for research to standardize Ayurveda medicine, the quality control of Ayurveda medicine, which is lacking now. So that we are planning to do through sir's guidance. And Madam, Dr. Gayatri Madam, she has not come. She is a DRDA scientist they all have joined our team to support this cause. And I would like to introduce our Abigail Madam, who is our HR, who is actually taking care of all he has taken the trouble to coordinate this event. And Rashmi Madam, our close family friend, she has been counseling our cancer patients in our center, and today they are happy for two reasons. One is because of our treatment, and second important thing is because of her counseling. They go back happily after her counseling. And I would like to introduce Shobha Madam, who is our admin in our team. And our senior consultants in our team, Dr. Ramya Madam, Ayurveda consultants, they take care of Garbha Samskara and women health. And Dr. Sujata Madam in our team, they are there to guide youngsters in our Ayurveda team. Dr. Swati Madam, who is a MD in Rasa Shastra. What I was discussing about, Dr. Devjyoti Sarkar, sir, mentioned, sir. And Dr. Sriniket Adiga, sir, about MD Dravya Guna. And Dr. Kasturi sir, again MD Rasa Shastra. Rasa Shastra is nothing but I was telling you about gold nanomedicine. That department involves very crucial medicine purification, preparation, etc. They are taking the trouble to run our pharmacy. And my friend Dr. Bhargav, who is sitting behind, who is MD Kaya Chikitsa. We would like to thank all our team members today. And there are maybe 15 people may be here at the same time. There will be 15. And I would like to introduce a very important person here who is not a doctor, but Nana Chikama, who is actually ನಾನು ಬೆಂಗಳೂರಿಗೆ ಬರುವಾಗ so she was staying near ಇಲ್ಲಿ ಗಿರಿನಗರದಲ್ಲಿ. When I was planning to come from Bangalore, Udupi to Bangalore, it was a COVID time. So ಬರುವ ಮುಂಚೆ ತುಂಬ ಜನ ನಮ್ಗೆ ಫೋನ್ ಮಾಡಿದ್ರು, ಬಂದರೆ ನಮ್ಮ ಮನೆಯಲ್ಲೇ ಇರಲಿ ಅಂತ. That was a COVID time. So they were fearful of COVID and doctors who were treating COVID also. So ಯಾರೋ ಅವಾಗ I was stayed in her home for 2 months. And they're always like my parents in Bangalore. They take care of us. They take care of our health today. So that we are able to take care of others. So ಇವತ್ತು ಅವರ ಕಾಳಜಿಯನ್ನು ನಾವು ಈ ಸಂದರ್ಭದಲ್ಲಿ ನೆನಪು ಮಾಡಿಕೊಳ್ಳಿಕ್ಕೆ her family what she has done. Thankful to you. Thank you.
Thus far, we have listened to experts who study and treat cancer through science and medicine. But understanding cancer is incomplete without hearing from someone who has lived through the journey personally. Someone who has experience, reflects courage, resilience, and hope beyond diagnosis.
Now, to introduce our final speaker for the day, I invite Ms. Divyamati from MSc Biotechnology.
Good morning, everyone. Today is a truly meaningful occasion for our college. We are gathered here not just for a program, but for an interaction with a person whose life story represents strength, courage, resilience, and hope. I welcome a remarkable individual, a general surgeon from Delhi, and also a courageous cancer survivor who has graciously accepted our invitation to be a part of this event. Cancer is a word that often brings fear, uncertainty, and emotional turmoil. It tests not only the body, but also the mind and spirit. The journey through diagnosis, treatment, recovery, and healing is never easy. It involves hospital visits, challenging therapies, moments of doubt, and immense physical and emotional strain. Standing before us today is someone who has walked that path with bravery and determination, transforming adversity into strength. A cancer survivor is not defined by illness, but by faith. With faith comes resilience. Survival is not just about medical recovery, but also the inner strength or choosing to move forward that turns the patient into a survivor and a survivor into an inspiration. Our guest embodies that spirit. Life's most powerful lessons come from real experiences. Through Dr. Devjyoti Sarkar's story, we will learn about mental endurance and importance of support systems. We will understand that health is not merely the absence of disease, but a balance of physical, mental, and emotional well-being. This program also reminds us of the importance of awareness and early detection. Many lives are saved through timely diagnosis, proper medical care, and informed decision-making. Stories like this encourage open conversation about health and inspire others who may be silently battling similar challenges. On behalf of our entire college community, I extend a heartfelt and warm welcome to our honored guest. We are deeply grateful that you have chosen to share your journey with us, and I'm sure it is inspiring. Let us listen today not just with our ears, but with our hearts. With immense respect and admiration, we welcome our inspiring guest with a big round of applause. Thank you.
Hi everybody. 2021, I left my job. I was running the Department of Surgery in a very prominent hospital in Delhi. I left my job because I thought that working and earning money for a hospital, why would I do that? I would earn a name for myself because money to anyways perish one day. So 2021, I left all comfort and I started my practice in surgery alone. 2022, November, I realized that I have oral cancer. I did not talk about it in my family. I had 4 things to do. One, I sent my mother out to my sister's place in Bangalore. I did not want my mother to see me suffering like that. Second, I had 2 very major surgeries to do. I did those things. Third, I had a free social service operative camp to attend. I did 27 surgeries in 3 days for free, with Dr. Charak. And fourth, I was waiting for Messi to win the World Cup. 18th of December, at night, Messi won the World Cup. 19th morning, I went for my biopsy. 22nd night, I received a report that I have cancer. 22nd night, for 5 minutes, I shouted. And then I thought that if one person in this whole world has survived cancer, it has to be me. 22nd December 2022, I was diagnosed. 5th of January 2023, I was operated for 16 hours. And I received a lot of radiotherapy and chemotherapy for about 8 months. And 2024 February, I operated a patient for breast cancer. You cannot fight cancer, okay? You have to accept it how it comes. The diagnosis, the stage, the treatment response, everything you have to accept. But you can fight the fear. You can fight the stigma. And you can fight all nonsense what other people tell you. That you can fight. Every day morning I used to get up. After around a whole night vomiting and all. And then I used to get up. I used to bleed from mouth. I used to go to pass stool. I used to bleed from rectum. But then I used to have bath and go for radiotherapy. I chose the longest and the toughest path because one thing, please understand, the first opportunity to treat cancer is the best opportunity. Never lose that. The opportunity which will come later on after recurrence is very, very unpredictable. So if you try to take a path which will be less painful, in the first opportunity, you might be losing the best opportunity. So, do not fall prey to these kind of statements that, oh, you are diagnosed with cancer, you are anyways going to die. No. Second is, whatever was told about me, you cannot fight cancer alone. You have to have people around you because every day I have been through it. I am seeing patients go through it. Every day you will feel like giving up. Every day. It is so painful. But 2 things. One, you should have a bigger purpose in life. That I'll get cured and I will do this thing. That might be anything. Right? Second, you should have people who love you, who are concerned about you, by your side. This battle cannot be fought alone. I have seen many patients who secured themselves after getting diagnosed by cancer. It doesn't help. I have scars here, inside my mouth, half of the tongue is gone here. Who cares? I'm very proud of all this. Who cares? I am operating. When I came first to Bangalore, when I met Ashwath after my recovery, in the airport I could not even stand. When they frisk you, they ask you to stand like this, right? I could not. With that metal detector, he was pulling my hand like this, because I couldn't lift it. So, it's been 3 years. I can do 30-35 push-ups. Purpose in life is more simple. Socially and relevant to the society, relevant to the family, that is the most important thing which will guide you and which will motivate you. Nobody can motivate you. Your purpose in life will only motivate you, right? So that motivation will drive you towards enduring all this pain. Another thing I want to tell you, the age group of cancer has come down. The age, I am 45, 46 years old. In my batch, I have 2 bypass surgeries and quite a few angioplasties within my friends. This was a disease of 70s age group. Malignancy was a disease of 60 plus age group. But when I was going through radiotherapy, I was seeing kids getting radiotherapy for cancer, young patients getting radiotherapy for cancer. So, it has no age group. Another thing I want to tell you is after the COVID and the vaccination, both, the world is never going to be the same. Never. It is just like the Hiroshima and Nagasaki. The world will never be the same after COVID. There will be a lot of cancers. There will be a lot of other diseases, unexplained paralysis, unexplained heart attacks. What we need to understand is we should not put in more risk factors into our system. We should not ignore small symptoms. And we should go to the proper person for treatment. Now coming to Ayurveda. I met Ashwath in that camp after my recovery. I was very slow. Hardly I could operate. I was not okay. I was bald. I lost around 18 kgs. And I could not stand for more than half an hour. He has seen me in that condition. Today I have hair more than almost 90% of my batchmates. After losing every single hair follicle of my body to chemotherapy. I operate, I do laparoscopy, I can stand and operate for 10 hours flat. Ayurveda has not only that, also they have Ashwath and his father. Not only that, every day I used to wake up in the fear of recurrence and sleep in the fear of recurrence. Because I could understand that my body has become something where if you give 1 dose of chemotherapy, I'll die. I push myself to the limits. Now if 1 dose of chemotherapy goes into my body, I'll die. Even the psychological upliftment and motivation I got from Ayurveda. I could not move my neck for more than 1.5 years. the fibrosis of radiotherapy, the toxicity of chemotherapy, they were all gone because of Ayurveda. I am very proud to be associated with this group because this group is going to flourish anyway, today or tomorrow. It is me whether I am a part of it or not. Because this is definitely going to be accepted. Swami Vivekananda told there are 3 stages. First, there will be ridicule. Ayurveda people, you don't know anything, you don't have any emergency medicine. That stage is crossed. Second is opposition. Now they are dealing with that stage. They will oppose because they will see good results, and the money-driven market of immunotherapy, chemotherapy, they will oppose. But the third is inevitable, and that is acceptance. So this is going to be accepted. And I heard Ashwath, I heard the director from that radio oncologist also, Dr. Nirmal and all. Modern medicine. Ayurveda is much more modern than modern medicine. I have seen it. I have, after that, with my association with them for the last 2 years, I have sent many patients, and I have received a sorry from a Padma Shri neurologist in Fortis, who told that one patient will not survive, and the patient is still surviving after the surgery I did, and they are treating for Ayurveda. I received a sorry from that gentleman. So acceptance is bound to come. You just need to do the good work. Okay? And lastly, I want to tell you one thing. I also heard about this insurance fiasco, that it's not sponsored and all. Surgery is a way of life. Surgery is not a profession. You do the same things every day, it comes into your personality. He also knows. I have been working like if the anesthetist is not giving anesthesia to the patient, or he will die, he is very old and all. I give local anesthesia and I operate parathyroid. I have operated colostomy without anesthesia. You don't want to give anesthesia? No problem. If you cannot decide the fate of a patient, right? So, today I am telling you, I am hearing this, but as the team will grow, I have seen this Bangalore super health guy, if you know him, Varun. If they don't give insurance for Ayurveda, we will make our own insurance. No problem. It will just be a matter of time and matter of acceptance, and people who are coming together will build up our own insurance that can also be, the super health guy has done. We can also do. So, money will never come in between education and treatment. No. It is your willpower, the intention of the doctor, and the strength of the patient will decide the outcome, not money. So, all the ladies in biotechnology, remember one thing. Protocols, I have been hearing this word a lot today. Protocols are for Jawans, not officers. Jawans who are not that much educated, they have to follow a protocol. Go from here, go from there, stay there, turn right, turn left, shoot that guy. These are for Jawans. For us, who have been educated, we are born to break and make new protocols. Okay? We are not here to follow. We will break whenever it is required for the betterment of that person or the betterment of society. So what they are doing, what we are trying to do is, we do not say that chemotherapy is bad. We do not say that immunotherapy is bad. But it has to be customized according to the necessity, age, and outcome possibility of the patient. Right? So if a doctor knows that the patient is not going to survive, Giving him immunotherapy which is worth some 10-15 lakhs, this is not what we became doctors for. We don't want to do that, right? And we have never ever argued that this is better, that is better, what Ashwath said. We will all be working together for one purpose, that Bangalore will become the pioneer of integrated medicine, combining modern medicine and modern Ayurveda. I'm telling you one thing, when I was going through radiotherapy in 2023, Tata Memorial Hospital in Bombay, they came up with a study that copper is useful to prevent recurrence in squamous cell carcinoma. They have stopped using copper 40 years back. Okay? So they are far more advanced. So Bangalore can be the torchlight bearer for the concept of the least morbidity of neoadjuvant and adjuvant therapy in cancer combined with surgery and immunotherapy and chemotherapy as and when required. Rigid protocols are not for pioneers. Every pioneer in the society, in the history of time, they have broken some protocol. So we are standing in front of a very, very bright future where, you see, every cancer is curable. You give 40, 50 chemotherapies, every cancer will be cured. But after 5, the patient will die. The operation is successful, but patient is dead. What's the point? So Ayurveda steps in not as a better alternative to killing cancer, but a much better alternative to providing a quality of life to the patient who is undergoing cancer treatment. That is the difference. So I am very, very glad to be a part of this program. Thank you.
Thank you, sir, for sharing your deeply moving journey with such honesty and courage. Your experiences reminded us that behind every medical term and treatment process lies immense human strength and hope. Listening to your story has not only increased our awareness but also inspired us to value resilience and compassion in the face of adversity. We are truly grateful to you for opening your heart and sharing your journey with us today, sir. Thank you, sir.
As we approach to the conclusion of today's program, I now invite Mrs. Priya R., Head of the Department, Undergraduate Program, Biotechnology and Microbiology, to deliver the vote of thanks. Thank you.
It's my proud privilege to propose the vote of thanks on this meaningful and memorable occasion. At the outset, I extend our heartfelt gratitude to our esteemed chief guest, Dr. Naveen T., Director, Kidwai Memorial Institute of Oncology, for gracing this program and for sharing valuable insights that truly inspired us and reinforced the importance of cancer awareness and early detection. We offer our deepest respect and sincere thanks to Ms. Bhavani's father, Dr. Y Tulzappa sir, and family and friends, Bhavani's friends, whose generosity and noble vision in instituting this memorial initiative have transformed personal loss into a lasting service to society. Your gesture continues to touch and benefit many lives. I also thank Bhavani's husband, Mr. Nagaraj, for arranging the live streaming of this event. We express our sincere appreciation to management of RV Educational Institution, the RV Trust, and our principal, Dr. Suchitra R., for their constant encouragement, guidance, and support in making this program possible. Our special thanks goes to Dr. Ashwath Rao and his dedicated team from Saukya Bharati Healthcare for their professional expertise, commitment, and compassionate service. We also extend our gratitude to Dr. Mahantesh for being instrumental in coordinating this event and the entire KIMO staff who are working relentlessly to ensure smooth conduct of the screening of the patients, of the people who outside. We express our heartfelt gratitude to Dr. Debjyoti Sarkar, a general surgeon from Delhi and also a cancer survivor, who courageously shared his experience with us. Your journey of strength, resilience, and hope inspired us all and reinforced the importance of awareness, early detection, and a positive spirit. Thank you for making this program truly meaningful, sir. We warmly thank all the participants who came forward for cancer screening. Your proactive approach towards health awareness is truly commendable and fulfills the very purpose of this initiative. A note of appreciation to our student volunteers whose enthusiasm, discipline, and service-mindedness were instrumental in organizing and executing today's activities seamlessly. We also sincerely thank the invocation song team for setting a serene and respectful tone for this event with a soulful rendition. Our gratitude also goes out to all the faculty members and parents, if they have come, for their encouragement, presence, and continuous support. I would like to acknowledge the efforts of the program coordinators, Ms. Nalina N. and Ms. Tanaya Nayak, for meticulously planning and coordination ensured for the success of this event. We also extend our special thanks to our non-teaching staff, Mr. Ravi Shankar, Mrs. Shashikala, Mr. Shiv Kumar, and Mrs. Prema for their invaluable logistic support and behind-the-scenes efforts. A special word of appreciation to Mr. Chandrasekhar Shashwati in charge for his supervision. Every successful event is the result of teamwork, and today stands as a testimony to what collective dedication can achieve. I also thank our student participants for coming and gracing this occasion and actively listening, and for their encouragement towards this program, and also participating, asking questions. I truly appreciate your gesture. I once again thank each and every one of you who contributed directly or indirectly to this, to the success of this cancer awareness program. Let us continue to work together towards building a healthier and more aware society. Thank you. Have a wonderful day.
Thank you, ma'am, for the gracious vote of thanks. With this, we come to the formal conclusion of today's program. I now request everyone to kindly rise for the national anthem.
जन गण मन अधिनायक जय हे भारत भाग्य विधाता पंजाब सिंध गुजरात मराठा द्राविड उत्कल बंगा विंध्य हिमाचल यमुना गंगा उच्चल जलधि तरंगा तव शुभ नामे जागे शुभ आशीष मांगे गाहे तव जय गाथा जन गण मंगलदायक जय हे भारत भाग्य विधाता जय हे जय हे जय हे जय 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 हे
Thank you all for your presence and participation. Wishing everyone a meaningful and a healthy day ahead. Thank you.
You want me to delete that?
Control shift delete.
Now
Now it's delete now.
recycle.
Lot of non-disclosure.